Good morning, everyone. Thank you for being here. I want to welcome everybody to the Senate Committee on Corrections this Wednesday, October the 9th, 2024. And before we get started, I do want to think about and pray for those that are affected by the Hurricane Helene in East Tennessee, Arkansas. In North Carolina, and other states that there have been a lot of deaths with that. So I want to thank TEMA and TDOT for all they're doing. I got an update yesterday from Senator Massey, who's over there for the last 3 days, as to what's going on and what they're doing. They're doing amazing work, and want to thank them for what they're doing, and those that pray for those that have lost their life. Also, I want to pray for those that are going to be facing Milton in Florida in a day or two, and hope that the things don't go as bad there as they did with the first hurricane. But Senator Pody, would you mind saying a prayer for this?
Yeah, I'd be honored to, Mr. Chairman. Holy Father, we just want to come to you, Lord. Lord, we know there's nothing that catches you off guard. Father, but as we have people that are hurting, our fellow Tennesseans, fellow Americans, Father, we just want to lift them up. That, Father, we can remember them as they're going through the recovery process right now. And for those that are in Florida, Father, as they're about to face this hurricane, Father, just be with them. I just want to ask a blessing on our first responders across the nation. Father, let them know that they're not alone. In the name of Jesus Christ, amen.
Amen. Thank you, Senator Pody. If we need a roll call or not, there are 5 members on the committee, but 2 are not able to be here today. So if you want to proceed with that.
Senator Briggs?
Here.
Senator Briggs present. Senator Pody?
Here.
Senator Pody present. Chairman Jackson?
Here.
Chairman Jackson present. Chairman, you have a quorum.
Thank you. Senator Yeager and Senator Yarbrough were unable to be here. Yarbrough had his fall break, and he had to plan a trip with his family. So that's why he's not here. And Senator Yeager had to be in his district for some commitments that he had. So, but anyway, we'll go ahead and get started. And besides the Department of Corrections, we have several groups here today that will be testifying and giving us information on corrections and what they're doing to help with corrections. And so I want to thank everyone who's traveled to be here. But with that, we will go ahead and get started. Is the commissioner first, or do we just want to go ahead for this? Okay. All right. Yeah, he's out now. Okay. What I would like to do is the first group that we have on the agenda is Project Return. And if you would just come forward and take a seat, and you have mics there. There'll be a button that you push, and anytime you see your mic is lit, it's on. And also, I want to be sure that you identify yourself and who you're with when you begin, and then we'll go from there. So I don't know who wants to start, but just identify yourself and you may begin.
Testing 1, 2. All right.
You're on. You're ready.
Well, good morning, Chairman Jackson. Thank you so much for having us this morning. My name is Rico X. I am the CEO of Project Return Incorporated, and we're just thankful for the opportunity to briefly share our work in the reentry space. Next slide. So as of late, we have in the state of Tennessee, we've seen some positive results as it relates to recidivism. And so recently it has gone down to 29%, which is great. However, next slide. But we also know that those that are returning from incarceration still face nearly 10 times the level of unemployment as it relates to their journey in terms of getting employment. And so the next slide, the genesis of Project Return was really born out of prison ministry. We are celebrating our 45th year of existence, and it was born out of prison ministry by two incredible ministers, Reverend Barnes and Reverend Beiswanger. And they were ministering to people in various facilities in the state. And they realized that after 1 or 2 or 3 years, some of the people that they were ministering to were coming back. And so that was the genesis of Project Return. And it really, the centering question that informs our work is, what does it mean to love your neighbor? And so at Project Return, our vision is really to work with people to achieve a full and free life after incarceration. And I'm going to hand it to our Chief Strategy Officer, Kelsey Hall, who will go over the next few slides.
Next slide. Is it on? Yeah, there we go. Good morning. Thank you guys for having us today. At Project Return.
If you wouldn't mind, pull the mic a little closer to
Yes,
you.
sir.
Yeah, so we
Is
can.
that a little bit better?
Yeah, that's better.
Great.
Thank you.
At Project Return, we believe that employment is the #1 predictor of someone's success after incarceration. So all that we do is centered around finding employment for those returning home to Tennessee. And want to note that we accept anyone who finds their way to our doors. We have offices in Nashville and Chattanooga. So regardless of conviction or where they were incarcerated, if they find their way to us, they are welcome and we will serve them. We're also not a mandated program. People come to us of their own volition. They know that we're about work and they want to work. And so next slide. We have served 628 new enrollees this year.
I want to recognize Senator Pody. I think he may have a question for you.
And Chairman, I can wait till the whole presentation is done and ask, or we can ask questions as we go.
Let's do it. Let's listen to the presentation, then we'll
Okay, great.
answer
Thank you.
questions then. So thank you.
Yeah.
You may go ahead.
Thank you. We have served 628 new enrollments this year, so folks newly released and coming to us, but we've served over 1,500 people. And again, we understand that employment is the #1 predictor of their success, but know that they need wraparound support in order to be successful. So we're providing birth certificates, state IDs if they're needed, food, transportation assistance, child support assistance, kind of you name it, that wraparound support that's going to help someone succeed. We provide clothing, shoes, and tools for the job. As soon as someone finds employment, we're able to provide all of that to them so they can get to work immediately. Next slide. In order to achieve this, we also operate 3 revenue-generating social enterprises, 2 of which create employment. And so we contract with local employers who are needing workforce, and we are able to staff their companies with our motivated participants. We also operate a property solutions company for those companies who are needing commercial cleaning, landscaping, property make-ready. We hire our participants directly and get them to work immediately doing that level of work. And of course, housing is a huge need here in Tennessee. So in 2017, we launched an affordable housing initiative, and we are owners of 32 properties around Nashville and soon to be property owners in Chattanooga as well. And we rent those to folks who are coming through our program successfully, and excited to keep expanding that work. Next slide. Just a little bit about our impact. Our 2 main metrics are high employment and low recidivism. And so we're seeing the impact of this work. We are aiming for 75% or above job acquisition for anyone who's coming through our doors. Again, that aim is to get them employed as soon as possible. And then we aim for low recidivism. Last year it was about 16%, but it dropped significantly for those who take more advantage of some of our transitional employment programs. Next slide. Did want to mention our Chattanooga expansion. So we, in 2021, were awarded funding through the Department of Human Services in order to expand our work into the Chattanooga area. We've been operating for 3 years there, and it's been very successful, and we're excited to say that we've served over 700 people there so far, and that office continues to grow. Next slide.
And before I hand it over to our guests today, I did want to talk about two important partnerships that we are just very pleased to be a part of in this reentry work. The first is with the Tennessee Office of Reentry. We are this year actually one of three agencies that are receiving some special funding to support workforce development. And so Project Return is the representative for the Middle Tennessee region for that funding this year. And also, we are part of some ongoing strategic planning work that is being led by the Office of Reentry in conjunction with the National Reentry Workforce Collaborative. And the goal of that is to really find some ways to streamline the reentry work that is happening across the state of Tennessee. So there are entities such as us. There are also chambers of commerce represented. And so we've just started that work, but it's super excited to lend our voice to that work. In addition to that, we've also received some federal funding through the Department of Justice. And so in partnership, particularly with the Tennessee Department of Corrections, the classes that we offer outside in both of our respective offices, we've been able to, as of October of last year, been able to offer a 6-week course of workforce development classes for people that are on pre-release, so anywhere from 2 to 6 or 7 months prior to their release. And so to date, we've been able to scale that program into 4 of the facilities. That is Riverbend, Deborah K. Johnson, Trousdale, and I've personally had the privilege of teaching 2 of those cohorts at the Attorney Center as well. And so we're super excited about that, and we're grateful for the partnership with TDOC to really be able to do that. To date, we have had many cohorts, and of that, we've had about 115 people that have graduated from those cohorts within the facilities, and we're beginning to see people being released. If you go to the next slide. It just shows a picture of one of our participants who I think was in Kelsey taught the class. And so one of our participants has since been released. She was able to hit the ground running. And she actually just recently came back to our office just to show off a new car that she was able to get after a couple of months of employment. And so at Project Return, if you go to one of our offices, you'll see a bell, and that bell represents new beginnings. And so anytime someone gets employment or finds housing, we ring that bell and everybody in the building starts cheering. And so we love to celebrate those big and small victories with our participants. And so with the last remaining time, I do want to hand it over to one of our participants who has actually taken advantage of all of the different aspects of our services and is currently an employee of Project Return now. And so his name is Victor Dyson.
Thank you. You're recognized. Yeah, you're just.
Good morning, Commander.
you're
How you
on.
doing?
Go ahead. Yes, sir. Identify yourself, if you would, please, sir.
Yes, my name is Victor Dyson. I'm a native of Chicago, and like I said, I was in TDOC, and I came up for parole in 2019, and Project Return came up there, and they said that they had the necessary tools that we needed to get started back on our feet. So as I made parole July 2019, I got with Project Return. And let me tell you, man, all the resources that they had has really changed my life. I can tell you. I'm not from here, but let me tell you, I feel as though I'm from here now because let me tell you, I used the program, I worked it fundamentally, and here I am now. I have housing. Like I say, I'm not from here. I have a vehicle that I didn't have. And like I said, and now as I was working, I am a proud employee of Project Return. I'm on staff. I'm currently a transportation coordinator, which I take the participant back and forth to work because like I tell them, I was in their same spot. So I can, I have some type of relationship with them and let them know that if you need anything, I am an example, perfect example, how to use Project Return and get back on my feet because I wasn't. I didn't know where I was going, but they told me if I make parole, come holler at them. And everything that they asked of me to do, I done it. And everything they said they were going to do, they did it. They provided it for me. So I beg Project Return and you all for continue doing your thing, what you're doing, giving guys like myself a second opportunity in life. Because I'm going to tell you, it's one of the greatest programs I ever been a part of. And I'm not just saying that because they're here, because I know my background. I came from the south side of Chicago. I didn't want to go back there. And I wanted a new environment. And if anybody say you're a product of your environment, I am with Project Return, because now I'm one of them. And I have no place I want to be, rather be, and being with them on a daily basis, because they're there. I've seen what they've done to the other participants, and that they've done, I mean, everything for one person to the next. They're limitless, and they're trying to help us get back in society and get up on our feet. And me now, I feel as though, hey, I'm a productive person back in society with the help of Project Return resources for guys like myself to come back here and live a better life.
Thank you, Victor. That's a great testimony. Appreciated, and glad you have had success with that. A couple of quick questions that I have, and then I'll recognize my other members of the committee. You said you're a transportation coordinator. I know transportation is one of the biggest things that are needed. Somebody getting out of a correctional facility and being paroled out. That's tough. That childcare, getting back with your family, not going back to the same environment that you came from. But transportation, though, is huge in so many areas. What's kind of transportation? You're a transportation coordinator. Tell me how you do that with the inmates that have they've just gotten out and have no transportation. How does that work?
Okay, well, Project Return, what we do is we have vans, and we make, like I say, every morning, they have to be at work on time because we have the partners. And what we do, we pick them up on time and make sure they get there back and forth every day that they have to work. And yes, I gets up at 3:00 in the morning to have these participants at work by 6:00. Yes, and like I say, that's what we do on a daily basis. Like I said, I went through the same process, and they're there for you. They're going to have you back and forth to work.
So you have vans in Nashville and then also Chattanooga that you operate. You have a number of vans. And I don't know how many inmates or people who are out on parole that you are taking back and forth from work. Is there a number that you have that are in your program that are participating?
Yes, sir. Yeah, it's about 40% of our total population. So again, we've served about 628 so far. So typically about 40 to 50% of those take advantage of our transitional employment. But we provide transportation assistance through bus passes to those who maybe don't want to work directly through us. But for those who are taking advantage of ProE, which is our staffing company, we are providing the van transportation every day, every hour.
Okay. Thank you. Senator Pody, I think you might have a question.
Thank you, Mr. Chairman. You mentioned jobs was the number one factor so walk me through the data on that.
Yeah. We have just really our own sort of organizational data shows that the recidivism rate drives lower and lower depending on someone's job acquisition rate. And so again, our predictors are 75% job acquisition. And we've seen for those who are in our job retention program, which means that they are full-time employed and are working with us for an additional 12 months, that drops significantly, typically around 5% or less. And for those who did both our transitional employment and that job retention program, it's 3 or less. So just our own data that shows that that number drops over time.
All right, so that's based on your experience at this point. How many people do you work with? How many inmates coming out do you work with?
Yeah, last year it was 850 between our two offices, and that is new enrollment. We serve about double that with people that are coming back through for various services.
And so how long are they with you?
It's about a 12 to 15 month program if they take full advantage of all the programs that we offer.
And then my last question is funding. How are you all funded?
Yeah, so we have three buckets of funding. We do receive some state appropriations from the Tennessee Department of Corrections. We also have a few state and local government funds that reimburse some of the services that we provide. So that's one bucket. Our social enterprises, which are revenue generating, provides about a third of our budget as well. And then the rest is just between like private foundation grants, individual contributions. But again, we are grateful for the recurring funding that we are receiving from Tennessee Department of Corrections, and certainly I think from a broader state perspective, there's still more work to be done, and just looking forward to seeing if there are opportunities for additional funding from a state perspective.
Okay, thank you.
Senator Briggs, you're recognized. Chairman Briggs.
Yeah, thank you very much, Mr. Chairman. The 29% recidivism rate, is that your recidivism rate, or is that generally a state recidivism rate?
Good question. Yeah, so that is the state's the recidivism rate, and it was up to closer to 50, and so over the last year it did drop to 29%. And as Kelsey referenced earlier, our recidivism rate is around 15 to 16%. And of course, for those that take fuller advantage of our programs, it will go to 5%. And then for people that take advantage of our housing, it's actually 0%.
That's good. When and this could be to any of you, but if we know there's going to be some people that are completing their terms in prison and probation and all of that, and there's other programs that are around also. How do they become aware of what's going to be available when they're released? I mean, and then how's it determined which program is best for them? Does the person being released hears this information and said, well, this one sounds better for me, or I'm sure there's some that just walk away, and that may be part of your 29% recidivism. But how is it determined who goes in to what program?
Yeah, I think that's a great question, and I think that the drop is very indicative of I think the partnership that the Department of Corrections is really forging with reentry organizations like Project Return, as well as just the existing reentry teams that they have within each of the various facilities. And we do what we call Enreach on our end. There are throughout the year there are various resource fairs within the facilities where entities such as Project Return will be there just to talk about the services that we offer. You also have the American Job Center that is there, and so there's a lot of this good collaboration with these different entities to provide an array of options for people, upon their reentry experience. And so for people that are released into Nashville and Chattanooga, they're more than welcome to come through our doors. And certainly for the people that we're teaching those 6-week classes, for those that have been released to Nashville and Chattanooga, it's been an awesome experience to see them in our class and then have them walk through the doors a few months later.
Thank you.
Thank you. Any other questions or? Okay. Let's see. I think that's all I've got too. So very good program, and very impressed with what you're doing. And thank you. I'm glad you have had good success with it or with the program, and
Thank you.
and changing people's lives who are being paroled out of correctional facilities. So thank you very much for that. Do you have any plans of expanding to other areas besides Chattanooga and Nashville?
We do. I mean, funding pending,
Yeah.
of course. But yeah, I will say that there is some lower hanging fruit, particularly in Rutherford County. I think we've gotten some inquiries in Montgomery County as well. Certainly Shelby County as well. But I think just by virtue of kind of our Middle Tennessee imprint, Murfreesboro and Clarksville seem to be some entities some areas where we can really have a satellite presence to continue to ramp up the needs that we see exist there.
Okay. Well, thank you all for being here very much, traveling in, and this is a great program, and I want to see it continue. I'd like to see it continue. So
Absolutely.
any success, please call my office or any of our offices if you have issues or needs or whatever, and we try to help with you. Help
Absolutely.
you with it. Thank
Thank you so much.
Thank you all for being here. Okay, next, I think we have Dr. Stephen Lloyd, who's here. He's the chairman of the Opiate Abatement Council for the state of Tennessee, works with Commissioner Williams in the Department of Alcohol and Substance Abuse. Dr. Lloyd, I'm glad to see you. You and I have gotten to know each other over the years, and appreciate you very much being here and taking time. I heard you give a presentation when I was in West Virginia. You were up there for that council meeting. So I thought this would be something that we need to hear here of what you're doing and what's going on. So we talked on the phone the other day, you and me, myself and Commissioner Williams, and thank you for doing that. If you want to just tell us what you do and how it works, you may begin.
You bet. Thank you, Senator Jackson. My name is Dr. Stephen Lloyd, and I am the chair of the Tennessee Opiate Abatement Council. First of all, it's good to see some friends up there, both yourself and Senator Briggs and Senator Pody. I'm a constituent, just so you know. I live in Mount Juliet. So, hopefully that'll help me here. I've told you about this, Senator Jackson, and I've had this discussion with Senator Briggs as well. Until we address the issues of mental health and substance abuse in the incarcerated population, it really won't matter what we do outside of there, just because of the sheer numbers. That about 80% of the folks incarcerated, either county lockups or state custody, have an issue in this area. And I love this. I love what we're doing here, because I learned something from Project Return that I didn't know. But when I look at that, it's Middle Tennessee focused, and we get 95 counties. And I'm a native East Tennessean, so my area of the state has been hit pretty hard around my dad's house. So thank you for recognizing that. But I look in the rural counties, and that's wonderful. I love what Project Return is doing. I think about scaling that. At the same time, the majority of our state is still not served by that, and so those are things for me. Just one stat I love to point out when we talk about opioids and we talk about the opioid crisis, particularly in my state, Tennessee. If you look at mortality rates following detainment, they're about 700% higher in this population. So I mean 700% higher death rate. If I translate that, and the reference for that, Senator Pody, is the Journal of the American Medical Association, Internal Medicine in 2018, and so I found that to be true. If you look at anyone who is released from incarceration, be it for any amount of time, 2 days, 2 months, 2 weeks, 2 years, 20 years, their risk of overdose and death in the first 2 weeks following incarceration is about 40 times higher than the age-matched individual in their community. And so this thing we were talking about the other day, Senator Jackson, with Commissioner Williams, was we have some programs in place that we know do good work. The issue becomes is people falling out from that transition from incarceration into the community. One of the things that the Project Return is obviously filling that void. And so, how do we look at that and then start to make sure that folks understand the resources we have in the state of Tennessee upon release? And that's one of the things that we talked about with regards to our navigators that we have around the state, because that program through Department of Mental Health and Substance Abuse has increased tremendously, even since my time at the department, less than 10 years ago. So, those are the things that I think that we need to be looking at. As far as our Opiate Abatement Council, as you all know, we have about $1.2 billion over 18 years. We're now 2 years deep into that. So we've got 16 years left. And, and actually that pot of money has grown with other settlements coming, thankfully. What our legislature and governor has done with allocating those funds to our council, I think this needs to be an area of focus for us. Because we have these funds available, and this is the highest need area that we have. And so for the folks behind me, I kind of putting this out there as what they do certainly sounds like something that would be a good proposal for the Opiate Abatement Council, particularly if you start talking about getting out of Middle Tennessee. Right now you're in Middle Tennessee, basically Davidson and Hamilton County. You're looking at Rutherford County as well as Clarksville. Clarksville's a big city now, and I think we all recognize that. But, as far as looking at this funding and expanding these programs further out into our state, and particularly the rural areas, I looked up there, and if you look at those recidivism rates and the effect that Project Return has had on them, and we start putting those into dollars, I mean, we care about human beings for sure. If you start putting those into dollars, look at the dollar amounts that, our return on investment is getting there. And so the thing for me, Senator, is knowing stuff like this exists. How do we put the people in the room to know these programs exist so that we can start to work? Because one of the things they had up there was substance use and mental health. It was up in the right-hand corner. What does the referral process look like for that? And how do we ensure patients get that care? And then what's the feedback to the organization? Because this is really about jobs and housing. And we heard testimony, from a graduate there. Look how different his life is. And, I was with RFK Jr. A couple of weeks ago, and he said something that really, struck me. He's been in recovery a long time himself. And we were talking about how to pay for these programs. And one of the things he said was people who get into recovery pay for themselves. And I think at least the four of us can see that, because we're not spending these resources in other areas. And so the thing I would like to see going forward is the CEO mentioned this, is collaboration. Collaboration, because before I walked in this room today, I had no idea what Project Return is. And I care deeply about this issue. And so I would like a forum to be able to work with that. We've got some folks I know in DOC that care about this, and how do we get in the same room and start to put together a system of care where these folks don't fall out. And I will disagree with a little bit. It's voluntary right now, and so I guess I raise an eyebrow about that, because I hear this all the time, and hopefully this is an open forum for discussion. But you say you can't force people into treatment, and I disagree with that. And you're looking at somebody. I didn't come to Nashville 20 years ago to get help myself with pom-poms. I came to save my medical license. And what I got was recovery and changed my life. And the only place that exists outside of somebody with a professional license is in the criminal justice system, because we have conditions of probation and parole that people must obtain. And so there'll be people who come there simply because they have to. But a lot of those people get recovery too. And so I think that is area for discussion as well. And there'll be organizations out there that beat me up for what I just said, but I believe in it and I've seen it. So I will open it up to questions. It's as good as I can summarize it. And I appreciate the opportunity to be here, and good to see you all.
Thank you for being here. Senator Pody, you want to begin, and Chairman Briggs next?
So I appreciate you being here and help. I also appreciate being a constituent, okay? And love to have coffee with you. We go in a little bit more deeper than this. But if you had to put your finger on one thing that would say, this would make a difference right here, if the state would just do blank, what might that be?
A little bit of what you're doing right now is facilitating these different groups that are working together. Senator Jackson, we talked about this with Commissioner Williams the other day. We have a lot of great programs out there, Senator Pody. How are they tied together, and who is helping our individuals who are incarcerated navigate these and make them aware that they exist, and then starting to hook them up with those resources? Because the single biggest issue we have in the state of Tennessee is housing. Right. And I think, every time we've done a needs assessment in the population I work with, that's what comes to the forefront. Well, we have some options out there to help people with housing. How do we make sure that they know about that upon release? And it's one of the things that Project Return is doing. But how do we do that and scale that statewide? That would be what I would say.
Okay. Is there any other state that you look at and say, they seem to be doing it a lot better than we are? Is there anything that you,
There are other states, I think, that are doing a good job with this. I do work in West Virginia right now, and it's one of the things I think they do a good job with. Now they've got a little bit of an advantage over us, because if we look at our jails and prisons in the state of Tennessee, we've got 95 counties. The sheriffs of those 95 counties are over each of those facilities, and then we've got the Department of Corrections, which is statewide, and then the feds. In West Virginia, it's one person over all of those except for the feds. And I think that makes it easier. And Senator, when you're trying to navigate 95 sheriffs, that's pretty difficult. And don't get me wrong, I'm not upset about it. It's just difficult. So I think that, if you have a way to centralize that, it's so that it's consistent. So it doesn't matter if you get arrested in Obion County or you get arrested in Johnson County, or our our inmates who are coming back out into the communities having resources that are available to everyone, and do they know about them? And so I think there are some other states that have done a really good job at this. One of the things I've seen in West Virginia is their Jobs and Hope program, which to me is the most amazing program that I've seen. The gentleman who gave us his testimony, he's got a job, and when I listened to him, I was smiling. I'm so sorry about this, but I could almost hear the pride in his voice. Right? I mean, that's a big deal. And you have responsibility. He gets up at 3 a.m. and he has a responsibility. Here's the other thing that he mentioned that I don't want to be lost. He's mentoring the other folks who he's now transporting. That's a big deal because they see him and they, well, heck, he can do that. I can do that. So these things are big deals. The Jobs and Hope program in West Virginia does that as well. And so I think there's some things that we can do with cross-pollination with other states at looking at things that have been successful. And I'll certainly take that back to our Opioid Abatement Council.
Thank you.
You're welcome. Thanks, Senator Pody.
Chairman Briggs, you're
thank you. Thank you very much for coming here. It's good to see you
Good to see
again. But, I'm going to get back to one of the first statements you made about 80% of the people that are in prisons and jails, it's related to drugs.
Mm-hmm.
I don't know what the statistics are on those 29% that are the recidivist. I bet it's related to drugs because, we all know, how difficult it is to kick that and to move forward. And, I was wondering if there's any information, and I know Mr. Dyson said he was from South Chicago, and he, when he got out, finished his time with probation, he stayed down here. In other words, he got away from those bad influences that were there. Do we have any information on what we need to do to keep the people that have served their prison sentences, they're back, they're into rehab, to keep them, keep them off the drugs? I mean, is it just, have we given them new skills so now they have transportation, housing, and a job? Or are there other things we can do to keep them keep them away from the bad influences? I heard someone say one time, "Tell me who your friends are, and I'll tell you who you are." And I think there's a lot of truth to that. Yeah. And if you can be around people who are a positive influence, get away from those that are the bad influences. Do we have any information on that? Now, this isn't necessarily just recidivism to go back to prison, but also on falling off the bandwagon, so to speak, falling off the wagon with alcoholism or drug addiction.
Yes, sir, Senator Briggs. Great question. And I'm so glad to be here under these circumstances today, because I feel like every time I'm in front of you guys, you're talking about medication, and medication is just a little tool. If we want to help people change their lives, these are the type of things we need to be talking about. And so with Mr. Dyson, he talked about, he's no longer, in Chicago and he's here. And I'm going to respectfully disagree with him a little bit, because that's a geographical cure. And the problem with a geographical cure is you take yourself with you. That's the problem, right? And I would argue that Mr. Dyson has changed himself. Right. He has followed a program. He has a job. He's got this internal self-worth now. And I would be willing to bet that if he went back to Chicago and had the same support systems, he would do well. Right. Because that's the problem with geographical cures. So in just what I do, Senator Briggs, and what I do, medication is one thing. Helping people change their lives are about social determinants of health. And I wished I was smarter than this, but about 5 years ago, I was sitting in my house and it dawned on me, this is Maslow, same Maslow that we learned about in med school. So meeting their basic needs. And when I see people's basic needs being met, housing being first, job, the ability to provide an income. Oh, by the way, the side effect is that you pay sales tax dollars in our state and you generate revenue, and we're not spending resources on you. So there's a lot of things that goes along with that. So these social determinants of health are the key indicator for me and my patients, and watching and seeing who moves forward and who continues to backslide. You're so correct when you talk about, you are who your friends are. So just, I want to switch over to a topic that's near and dear to me, which are my female population. A lot of times they are in environments where they're being abused, and people look at them and say, well, you need to get away from that. Well, thank you. That's helpful. I don't have anywhere to go. Right. So it's not like that I like being abused. I don't have a way to provide housing and money for my kids. And so I think when we start talking about the things we're talking about here today, which is housing, which is giving people employment opportunities and help them start to provide a living for themselves, then I think that's where we truly move the needle in helping people find recovery, Senator.
Thank you. Just by the way, how's your dad? I meant to ask about that. when you
Dad's
first sat
good.
down.
He's 83. He's resilient. I think about every bridge around his house has been washed away. He lost a member of his church who got up on top of his house and unfortunately, lost his life. But the community, Dad says the community is responding. I have a clinic in Newport in Cocke County, and we know what happened in Cocke County, and our folks are responding there. One of the things I love about being in Tennessee, and in particular rural Tennessee, and is community response. I mean, I don't know about you guys, but I've very rarely got answers from Washington. I get answers from my community, my county, and there's a few mayors up there I've sent text messages to. One's Patty Woodby in Carter County, as I've watched Patty lead the effort there in Carter County, and then my county, Washington County, and Joe Grandy. So I'm very proud of the community support senator, and Dad's doing great. He's out. He's got a chainsaw. Me and my sister get on him about some stuff he probably doesn't need to be doing, but I'm not sure he's listening.
Well, I'm glad to hear that, because I know you often go up there to visit your dad, and
I do.
Lucky to have a dad that's at that age and still very active, and so I'm glad he's doing well.
He did send me some pictures the other day that were pretty heartbreaking, because Dad and I love the trails around Unicoi County, and so we hike them and bike them a lot. Even at his age, we do. Although he's got a motor on his bike, but that's another story. And he said, "Steve, these are all gone." And for me, being in East Tennessee, and these are the kind of things that happen to somebody else, right? And now they're in my community, and so it's heartbreaking. And our governor has been up there numerous times, and I don't think people realize the impact of having your governor show up, and it's huge. And so I'm proud of the response from our state. Thank you all.
Yeah. Well, I know, as I said earlier, Senator Massey's up there. She's been up there the last several days. She was in Unicoi County yesterday, she told me, but she said Governor Lee's been up there, Commissioner Ely has been up there, and several others, and said the first responders, the Department of TDOT has been amazing to get things done. They'll get those bridges and those roads fixed with the things they're doing. They have plans to get those things fixed as quickly as possible.
Yeah.
So
Yeah.
I'm glad of that. So any other questions from, well, I'm like you, Project Return, Meta Valor, just different groups that do amazing work for reentry is amazing. And we need to get them together, make sure that when the person does get paroled out of prison, that they know about some of these resources that we have and things that you just talked about. So thank you very much for being here. I really appreciate you coming. It's always good to see you too.
Good to see you. Thanks,
Yes,
Senator.
sir.
Thank you, guys.
Thank you. Okay. Next, we have the Independent Prison Oversight Panel discussion. I'm not sure who's with that. If you want to come forward and take a seat at the table, and you can push the button. Mike will come on to see the red light on your mic. You'll know it's active. And if you would, each one of you be sure and identify yourself, who you're with. And for the record, this is being recorded, so I want to be sure that everybody knows who is speaking. So you may begin.
Good morning. Thank you for having us. My name is Jeremy Tripp. I'm the policy director of One Voice United. My colleague Andy Potter here is going to be giving our testimony here today, but I'm free to answer any questions when we're complete.
Chairman Jackson and Briggs and other members of the committee, my name is Andy Potter.
Yeah.
I am the founder and executive director of One Voice United. And I want to take a moment up front and thank you all for allowing me to respectfully and humbly present our testimony here today. I also wish to just recognize the current discussion around independent prison oversight and just say that any conversations, positive or negative, provides an avenue for a deeper dialogue, accountability, and more comprehensive understanding of the issues that we face by our profession. Today, I'm going to focus my time on one such issue, but would like to first say a little more about myself and the organization that I represent. One Voice United is a national organization that's really dedicated to advocating for the welfare of corrections officers and other frontline staff, and ensuring that their expertise, their voices, and their perspectives are included in the national debate around criminal justice reform. Oftentimes, when these conversations happen, they're left out, they're left behind, they're overlooked, and they're marginalized. So our organization does as much as we can do to lift those voices up when these conversations take place. I myself have over 30 years of experience working inside and around the criminal justice system. Most of that as a proud Michigan corrections officer and a leader among my peers. I sit before you today because Tennessee, like many other states, is experiencing a critical staffing crisis that threatens the very mission of corrections and puts both the staff and the incarcerated in harm's way, along with the communities where these prisons are located. The staffing crisis that I'm referring to really doesn't have any borders. It's not one state's issue. It's not the fault of any one commissioner or director. And it can't be solved by one single department, state, or entity. It's a national problem, and it impacts every aspect of corrections by asking the staff to just do more with less. Often, this results in excessive work hours, multiple mandated shifts per week, leading to increased overtime costs, burnout, less job satisfaction, and an inability to perform everyday security rehabilitative functions. As members of this committee, you all know the ability of a department to successfully carry out its mission hinges on the capacity to recruit, retain competent and professional staff who understand their charge and have the resources, knowledge, and the resolve to carry that out. The Bureau of Justice Statistics lists Tennessee with a current staffing ratio of 2.86 inmates per every officer. That's 2.86 inmates per every officer. And on the surface, that sounds like pretty good statistics, really. Most people looking at that might say, that's not too bad. But it's very misleading. And we know that these statistics are not truly reflective of the staffing crisis, the strain that's happening inside of these facilities, or what's being experienced with the 24/7 nature of a corrections operation. And I commend members of this committee that have taken their time to actually go in, meet with those men and women who go in there and do a very difficult, dangerous job every single day and see the stress and see how much the strain is on these correctional facilities and the directors and commissioners that oversee it. It's a similar situation in many states where staffing has reached a dangerous level and officers are being mandated to work additional shifts multiple times a week, and non-custody staffs are being ordered to fill custody and security positions, placing them in units and other unfamiliar situations with little training or experience, a process that's called augmentation. From my humble experience, I can tell you that I totally understand the difficult situations that are leading departments to explore some of these kinds of alternatives. But in practice, it's just not enough to find a body, a warm soul to fill a position or a vacancy inside of these facilities. To be a competent and professional correctional officer, it takes time and it takes training. Not to mention the fact that augmentation takes key personnel such as nurses, teachers, and administrators out of their primary functions and throws them into a security position without replacing the services that are lost on the other side. For frontline professionals, staffing shortages lead to diminished observation skills, less intelligence gathering, overtime surges, slow response times, and adds an enormous strain to family relationships. In fact, multiple studies indicate that correctional officers suffer from PTSD, depression, suicide, heart disease, burnout, shortened lifespan, and other physical and psychological ailments at a rate that's well above the general public. And for those in our care, Staffing shortages mean programs are slashed, visits are reduced, time on lockdown is increased, which leads to the tension that builds. And before you know it, everyone's patience are as thin as paper. The reality is that in most prisons, it's not uncommon for the officer inmate ratio to exceed 60, 80, even 100 to 1. I've personally experienced this, especially in the yards and the dining halls of medium to large facilities. And if you add the depleted, unpredictable staffing numbers on top of this already delicate imbalance, you have a situation where the safety and the security of the institutions must be prioritized, and every other thing that happens inside of those facilities suffers. To combat this reality, a lot of well-meaning attempts are being initiated by departments, heads, and legislators in various states. Some of those attempts include lowering entrance requirements for new recruits, shortening academy times, and offering signing bonuses. Although they're good intentions and they're under enormous pressure when they make these decisions, none of them have successfully addressed the crisis to a scale of lasting impact. Some of those attempts that I mentioned may even lead to a much more dangerous implication for the future. Additionally, inadequate staffing levels limit the availability of programming, rehabilitative services, further hindering efforts to promote the positive behavior and reduce recidivism among those in custody. Addressing the staffing crisis is the best measure to help ensure success, and more importantly, it's essential to creating a safer and more secure environment for both those that are working in there and those who are incarcerated. Now, historically, when we offer adequate compensation, like the significant pay increases that were approved here in Tennessee, it helps up front, and it makes a big difference. But hiring new employees is not the only issue. It's a staff retention that's critical. In an area where, despite our best efforts all around the United States, our agencies are just falling short. Research shows that most new hires quit the corrections profession within the first 18 to 24 months of employment. And to overcome this trend, we must address some foundational issues. First are the conditions of employment. There has got to be a shift away from the top-down paramilitary structure of our administrations. Research and studies done on retention show that overwhelmingly that it's not the incarcerated population that drives away good employees. It's a lack of communication. It's a lack of recognition. It's a lack of transparency along with outdated and uninformed policies. And in short, the level of expectations and demands of today's correction system is just outgrown the current level of training and has diminished the profession to a point where staff just feel devalued and expendable. If you couple that with an unwillingness by staff to just silently endure the challenges that I just laid out, it becomes clear that the short and long-term needs, wants, values of new officers just no longer align with the current culture and demands of corrections departments. Fortunately, there are some remedies and some actions that can be taken to address some of these issues, but they require thoughtful inclusion, planning, and input from all the stakeholder groups. While I don't presume to have all the answers, I would like to share just a few items that my organization has heard and learned by talking with staff all across the United States. To make the field attractive, we must honor the aspirations and concerns of new employees by ensuring that they feel part of a valued team starting day one. This involves 21st century training to meet the new demands enhancing pay, reducing healthcare costs, implementing healthy, employee-involved wellness programs, and offering incentives like education benefits, shorter vesting periods for pensions. And while all those incentives I just mentioned are crucial, we must also ensure the staff feel as safe as possible in these situations, respected, recognized, and valued for their work. And without achieving these objectives and including those voices and lived experiences of those who will be impacted by the success and failure, true rehabilitation is unrealistic, and prison systems will continue to fall short of their primary mission. In closing, at One Voice United, I can say that we are extremely proud of our partnerships with officers, staff, employee associations, and administrators across the country, and we stand ready to work with any agency or advocacy group in addressing our mutual concerns and moving corrections forward to the 21st century. I want to thank you very much for the opportunity to be here today and talk about these important issues. I'll stop there and I'm open for any questions.
Okay. Thank you very much for that. I appreciate it. Other states that are doing this better than others, what states are those, and maybe a couple of items on what they're doing to make improvements?
You know, we're working with a few states on trying to realize what we can do to make this situation better and to bring people into this profession and to hold on to them and to create an environment that's healthier, safer. And now I can say Connecticut, Pennsylvania, there's programs like the True program and Little Scandinavia, and there's other states that are embarking on new programming as well. But I would emphasize this. There still needs a lot of studies done. There still needs a lot of communication and involvement with the staff. I know the staff, sometimes frontline staff can be viewed as part of the problem. But we advocate that they're also part of a solution and should be brought in up front and should be looked at as a stakeholder, the true professionals, the true consultants. And that's not happening nearly enough. So I would just say there are states, I commend them all and I work with some of them and they're trying their best in these circumstances, but I just feel like there's still this blind spot.
Okay. Questions from Senator Pody? You're recognized.
Thank you, Mr. Chairman, and I appreciate you coming. Now, you mentioned there was research showing the turnover rates. Would you share that research?
Well, I think the research that we do when it comes to turnover rates, I can let Jeremy speak on this a little bit more probably.
Yeah, I can just say if you want, we can provide all of the research that.
Yeah, if
that you
you'll just
mentioned.
tell us your name.
I'm sorry, Jeremy Tripp, Policy Director for One Voice. Yes, all of the research that we mentioned in here, we'll make sure that we provide links and make sure that you can access it all.
Great, thank you. Now, a lot of the same comments that you've made, I've heard from emergency management, educators, police officers, nurses, even the tradespeople saying that we need more employees, we got to pay them more, we got to have them more involved and such. You're saying the same thing that so many other trades and such have said, and professionals have said the exact same thing. Is there anything specific, though, concerning our officers who I think are doing a terrific job, that you're saying that we need to help them do this that's outside of the normal employment, outside of other state employees? What is it that they're looking for? Now, safety was one concern that would be something, but is there anything else?
Yeah, I believe that, and with all due respect, those are all commendable professions and dangerous professions. But, correctional staff endure 38% more PTSD rate than any other law enforcement, than any other profession that's out there. It's like the equivalency of going into a war zone daily. For me, it was 30 years. And you can imagine what that does to your family life, your home life. So yeah, employee involved wellness programs that help to cope with the amount of stress and the trauma that you endure daily, that you go in, that those kinds of programs, family wellness programs where you have a support group that's there to help you, you have to remember that going in there each day, it compounds itself. You don't get a chance to decompress and lose that trauma that you might see. You might go back into the same exact housing unit where someone was murdered and maybe right in front of you and you couldn't stop it from happening. Or somebody just passes away from natural causes, and as hard as you try, you can't stop that. And that's trauma that builds. So it's a little different, I think, for the men and women that go to work in there every day. And I think that piece gets forgotten about. But there are things like wellness programs and things that I think are essential.
Chairman Briggs, you're recognized.
If I tried to interpret this correctly, if we're looking at 2 or 3 things that would, that would improve, our correction officers' work environment and all, obviously pay is a big one. I mean, that is for everyone. But also you mentioned the ratios. I think you said here it was 2.88 per correction officer. And even that can be a little bit misleading, with that. And the third was just, like maybe the respect. To me, that one's a little bit more vague or might be a little bit harder to address. Or maybe it's, just be nice or something. But it gets back a little to what we were talking about, this recidivism rate. There's 2 ways we could address that ratio. One, we can increase the number of correction officers. And then the other way is to reduce the number of prisoners and having alternate programs. We have the drug courts, we have veteran courts, we have day reporting centers, and pretty much try to hold our prisons for where the people that actually need to be there. There's a variety of reasons about why we punish people. Some of it's punishment, rehabilitation, to serve as examples to others, et cetera. But a lot of this gets back to what we talked about earlier, is just trying to reduce, maybe we need to look at ways to reduce the number of prisoners, rather than, I know Texas has done a really good job at that. But it's more of a comment than asking a question. But there's, because it's really hard in this environment. We hear it from, you talking from a correction officer's advocate to people, working at the truck stops and all. Everyone, I stopped at Buc-ee's this morning and in Crossville and got a big cup of coffee, and they're paying bathroom. I mean, they call them restaurant. I took a picture of it that they have out there, what they're paying, $21 an hour. Just, just be willing to go in there and work as a janitor in the bathrooms. And that's what we're competing against, with even trying to get correction officers. To me, that sounds like a lot of money, but
It's true. And the level of professionalism that
Yeah.
they want when they come into this profession.
Yeah.
It's not, when they get there, they realize it's not really what they thought. It's a system that's been broken for a long time. I agree. There's people in there that probably deserve to leave and go out, and we should do everything we can do here in America to make sure that happens, because we incarcerate way too many people. It's too expensive, too political, and too big for any one state to really wrap its arms around. So it's going to take all of us to come up with some of these solutions. I love the testimonies we heard earlier today. That's exactly the kind of work we should be doing. And those that work in those correctional facilities should be brought in a partner and thinking that way, not being brought in and being a part of a us versus them system that we have right now. So I agree with everything you said, Chairman.
that's all I have.
Okay. Well, thank you. Thank you for this. I don't know where you came from, but thank you for traveling in here.
Yeah.
So testimony. I'm sorry.
We have 2 more people.
Oh, okay. All right.
Council, prison locals, and families.
Okay. So they're different groups.
Correct.
Okay. All right. All right. I'm sorry. I just getting straight here. So we do have the Council on Prison Locals, and then also Families Against Mandatory Minimums.
Yes, sir.
And okay, all right. I'm sorry, I didn't realize that they were all were different. So you may go ahead and just identify yourself, who you're with, and give us a little explanation. We're starting to run a little long, so I do want to give some time for questions and answers too. So
Thank you,
for
Senator.
being here, and you may begin.
My name is Mike Morrell. I'm with the Council of Prison Locals. First, I'd like to thank my colleague, Andy. That was well said testimony right there. Good morning, Chairman Briggs, Chairman Jackson, and distinguished members of the committee. Also, any correctional staff here today. My name is Mike Morrell. I'm here representing the Federal Council of Prison Locals. My position in the council is a National Legislative Coordinator. Our council represents 35,000 members who work in various positions in the Federal Bureau of Prisons. I've worked in the BOP for 13 years, and while residing in a faraway land named New Jersey, I am here today to address three of the most critical issues plaguing our prison system, both here in Tennessee, New Jersey, and nationwide: understaffing, underfunding, and insufficient oversight. These problems not only create unsafe and inhumane conditions for both staff and inmates, but also undermine the goals of rehabilitation and public safety. To begin, the issue of understaffing in the prison system has reached a crisis point. Over the past decade, we've seen a steady decline in staffing levels across the nation, even as the number of incarcerated individuals remains high. Many facilities are operating with far fewer correctional officers, healthcare providers, and rehabilitative staff than are needed to safely manage prison populations. The shortage of correctional officers is perhaps the most visible symptom of this crisis. Some facilities report 20 to 30% drop in critical staff positions. These shortages force remaining officers to work excessive overtime, sometimes double shifts for days at a time, leading to physical and mental fatigue, as Andy had mentioned. Overworked officers are less able to effectively supervise inmates, respond to conflicts, or maintain security. The consequences of this are stark and directly responsible for the following. 1, increased violence. Understaffed prisons often see higher rates of violence. With too few officers to manage large populations, inmate conflicts go unchecked. Fights between inmates can escalate, and officers may not be able to intervene in time to prevent serious injuries or even deaths. In extreme cases, riots have erupted in both federal and state prisons, jeopardizing the lives of everyone inside. Delayed response to emergencies. When an emergency arises, whether it's a medical crisis or a violent outbreak, every second counts. Understaffed facilities are slower to respond to these incidents, and this delay can have deadly consequences. Whether it's responding to a medical issue like a heart attack or staff in need of assistance, inadequate staffing levels directly impact the safety of inmates and staff alike. The third is what I like to call the V effect. There is not a problem I could name that takes place in a prison that would not significantly change with adequate staff. I often use the example of a V. In the open mouth of the V could go any problem a prison could face. Inmates not receiving programs, fed into the V, and followed to the bottom point, the answer is more staff needed. Due to shortages in correctional officers, non-correctional staff like teachers, which I am one, counselors and drug specialists are asked to work correctional posts under the practice known as augmentation. Without staff in these departments, often they are forced to close and provide no services. Another problem, contraband. Fed into the V and followed to the bottom point, the answer is always more staff needed. Lower inmate to staff ratios mean more staff are available for searches and interdiction. This theory is utilized by police departments all over the country through community policing. The idea that more police that are seen in the community, the more criminals are reticent to act. A prison is a community, maybe not one most want to live in, but the same theory applies. The greater the presence of law enforcement, the lower the instances of crimes. While understaffing presents an immediate and visible challenge, the deeper issue lies in the lack of effective oversight in the prison system. Most prisons operate with relatively little external scrutiny, allowing systematic problems like understaffing, medical neglect, and unsafe conditions to persist unchecked. Both federal and state prisons have their own internal oversight mechanisms, but these systems often fall short of identifying and addressing critical issues. Inspections of prisons are infrequent and often fall short of identifying and addressing problems. Reports that document understaffing, healthcare shortfalls, or unsafe living conditions are often met with little action, as most prison agencies struggle with budget constraints and administrative inertia. The practice of doing more with less is often the answer when agencies police themselves. Moreover, prison staff, including correctional officers and healthcare workers, frequently operate under significant pressure to minimize problems rather than report them. Staff may fear retaliation for whistleblowing, further reducing transparency. This internal culture can obscure the true extent of the crisis in many facilities, allowing dangerous conditions to persist. External oversight, particularly from independent bodies, is essential to ensuring transparency and accountability within the prison system. Unfortunately, federal prisons are largely insulated from meaningful external review. The Government Accountability Office, GAO, and Office of Inspector General, OIG, conduct occasional audits and investigations, but these often are limited in scope and resources. There is also a greater need for congressional oversight. While hearings like this one are a step in the right direction, consistent and ongoing scrutiny is required. Regular inspections, independent reviews, and transparent reporting mechanisms should be mandated to ensure that prisons are complying with basic standards of safety and human rights. A key aspect of this oversight must be addressing the staffing crisis, as adequate staff levels are foundational to running safe and effective prisons. Without effective oversight, it is difficult to hold prisons accountable for their failures. Despite frequent reports of understaffing, unsafe conditions, and inadequate health care, few facilities have been forced to make meaningful changes. This lack of accountability creates a culture of complacency where both inmates and staff are placed in harm's way and the public trust in the prison system is eroded. To address these intertwined issues of understaffing, underfunding, and oversight, several reforms are urgently needed. Immediate staffing and funding increases. Working in a prison, by its nature, is an undesirable job. How do you get someone to work or stay in an undesirable job? There is a quote I often cite, and is the answer to all your questions is money. Both federal and state budgets must allocate more resources to the prison system to address critical staffing shortages. While Tennessee has taken a great step in this direction with an over 35% pay increase, more work is needed to retain staff. Competitive salaries, improved working conditions, and benefits must be provided to attract and retain correctional officers, medical professionals, and programming staff. I would like all of you right now to picture a 22-year-old job seeker in our country. Here is the current pitch to work in the prison system. You will work shift work, overnights, weekends, holidays, often being forced to stay for another shift past your scheduled one. You will work around some of the most dangerous people in the country who spend 24 hours a day figuring out ways to still commit crimes. And you will do this all for a paycheck that will equal working at Target or Buc-ee's. Oh, also, you can't bring your cell phone to work. The dangerous nature of working in the prison system most likely cannot be helped, but the ability to attract qualified and motivated employees can only be done by paying them a salary commensurate with the dangers and issues they face every day. Increased funding could provide better training, which is desperately needed, and access to wellness programs for staff. Independent oversight authority, an independent oversight body separate from prison agencies, should be established to regularly monitor prison conditions. This body should have the authority to conduct unannounced inspections, review staffing levels, and ensure compliance with state and federal standards regarding inmate care, staff safety, and prison conditions. Public reports should be issued regularly to ensure transparency. Finally, better congressional oversight. Congress must take a more active role in overseeing the prison system. This includes holding regular hearings like this one, commissioning reports on prison conditions, and holding agencies accountable for implementing reforms. Special attention should be paid to staffing levels and healthcare outcomes, which are both critical indicators of a prison's ability to operate safely. Recently, our council has worked with the Senate and House members to pass the Federal Prison Oversight Act with overwhelming bipartisan support. This new law will require the Department of Justice Inspector General to create an ombudsman position to conduct comprehensive risk-based inspections of the BOP's 122 facilities to identify problems that affect incarcerated people and staff and to provide recommendations to address them. In closing, the conditions in our prisons are a reflection of the values we hold as a society. Understaffing and lack of oversight are not just administrative failures, they are failures of justice, safety, and human dignity. By addressing these issues head on, we can create a prison system that is safer for staff and inmates, more transparency, and ultimately more effective in achieving the goals of rehabilitation and public safety. I urge this committee to act swiftly to address the staffing crisis and to implement the necessary oversight reforms to ensure accountability in our prisons. Thank you for your time and attention to these critical matters, and I'm open to any questions.
Thank you. I think what we'll do is just move along to the Families Against Mandatory Minimums and hear from you, I assume, and then we'll ask questions.
Thank
after
you,
that.
sir.
So, thank you very much. You may begin, recognize yourself, who you are and who you're with, and then you may proceed.
All right. Thank you, Chairman Jackson, Chairman Briggs, and Senator Pody for allowing us to speak before this subcommittee. My name is Matthew Charles. I live here in Nashville, Tennessee. I served 22 years in federal prison for nonviolent drug offenses before becoming the first beneficiary of the First Step Act signed into law by President Donald Trump in 2018, and was honored to attend the State of the Union address as President Trump's guest in 2019, as well as to be called back by his administration several times in addressing some other things. Since then, I've traveled the country speaking with state and federal lawmakers about my experience and about safe and effective justice reforms. I testify today on behalf of FAM. Originally, it was founded as Families Against Mandatory Minimums. Now we go by Families for Justice Reform because we deal with sentencing and prison issues from the day someone is sentenced until the day they are released. But it was founded as an organization against mandatory minimums because we felt that a person should receive an individualized fair sentence based on the crime they committed without being categorized with others that may have a larger or greater role in the offense. I testify today on behalf of FAM as their senior policy advisor. FAM is a nonpartisan, nonprofit organization that advocates sentencing and prison policies that protect public safety, that are individualized, fair, and preserve families. I thank the committee for having this hearing and allowing me to speak about the need for independent prison oversight in the state of Tennessee. Andy Potter of OVU and Michael, they both spoke regarding the staffing levels and the need for staffing in Tennessee prisons, Tennessee is not an anomaly. This is nationwide. But there's two populations of people that actually are involved in this. One is the staff, the others are those that are incarcerated. So if the staffing levels are affected, so are those that are incarcerated. So I speak on behalf of those that are incarcerated and their families. Without independent prison oversight, problems with the Tennessee Department of Corrections have been allowed to fester, and the results have been disastrous for prison staff and those incarcerated. These issues include rampant violence, gangs, extortions, drugs, poor health care, lack of rehabilitative programming, educational or vocational opportunities, and dangerous low staffing levels that lead to lockdowns and chaos. These issues have begun to come to light through the media and through an investigation, as well as the Comptroller's 2023 audit of the Tennessee prisons, all 14 of them. So therefore, I recommend that the legislature adopt policy similar to that of the recently passed Federal Prison Oversight Act. The Federal Prison Oversight Act, which was signed into law this July, will create first of its kind independent oversight over all 122 federal correctional facilities. I had 121. Michael said 122. Okay. The federal prison oversight passed with the support of every member of the Tennessee congressional delegate. Passing out of the House with a vote of 392 to 2 and by unanimous consent in the Senate. The Federal Prison Oversight Act accomplishes oversight of covered facilities through two primary mechanisms. One, it tasks the Inspector General with comprehensive risk-based inspections of public and private facilities to identify shortcomings that affect correctional staff and incarcerated people and to provide recommendations to address them. The Inspector General will assign each facility a risk score, and the high-risk facilities will receive a more frequent inspections. The Inspector General will report its findings to Congress and the public. Furthermore, the Bureau of Prisons is charged with responding to all inspections within 60 days with a corrective action plan to address the issues unearthed during the IG's investigation. Secondly, the bill establishes an ombudsman within the Department of Justice to perform targeted investigation into issues that adversely affect the health, safety, welfare, or rights of incarcerated people and staff. These investigations can be initiated by way of a complaint from an incarcerated person, a family advocate of an incarcerated person, a representative of an incarcerated person, a correctional staff member, a representative of a correctional staff member, a member of Congress, and a member of the federal judiciary. An independent prison oversight body could provide intelligence for this committee and the legislator, presented unbiased, reliable, and accurate reporting on the state of facilities and repairs, staffing needs, programming, food shortages, security risks, endangered conditions for staff and those that are in its custody and care alike. Information could inform or guide lawmakers' choice about how to improve Tennessee Department of Correction and ensure that it operates on a sound and sensible budget. Annually, about 1.3 or greater is spent per year to the Tennessee Department of Corrections. This could be done with close to $1 million or less. That's 0.1% of the annual budget, overseeing over $1 billion that is spent. Tennessee is ripe for independent prison oversight and should look to the Federal Prison Oversight Act as a model. In a national poll, 82% of Americans agree that every prison system should have independent prison oversight. That's the reason I state Tennessee is not an anomaly. This needs to be done in all prisons. Indiana is doing it, Nebraska is doing it, Iowa is doing it. Independent prison oversight benefits everyone. Correction staff deserve a safe, healthy work environment and also need a place to go with complaints that, for whatever reason, are squashed, unanswered, and ignored. Incarcerated people have a constitutional right to safe, healthy, humane prison environment and need a place to go with their grievances when there isn't one. Families of incarcerated people need someone to call when they cannot get help or answers for their loved ones. Independent prison oversight will aid this committee in doing its work and benefit correctional staff, incarcerated people, and their families. Thank you for your attention today and your leadership in this matter. And you can ask any questions or I'll be available for any questions.
Thank you very much for that. I'm very interested in what you had to say about the program that the Federal Prison Oversight Act. I want to find out more about that. I'll talk to probably Congressman Kustoff, who's in my district, about this, because he's very attuned to corrections and what's going on with that on the federal level and trying to make some changes in contraband and things like that. But I'm very interested in hearing more about that. But I'm not going to ask a lot of questions about it now. Just we were starting to run a little long, so I just wanted to, but I would like to get your contact information and talk to you more about that program. So
Yes, sir.
any other questions from Senator Pody? You recognize?
Just a quick comment. I'd be very interested in following up with you. So when you have those meetings, if you loop me in, I'd be happy to come in on that. Thank
Absolutely. Any other questions? So thank each one of you for being here. Very good information and gives us a lot to think about and things that we need to do to try to help the Department of Corrections here to be able to have staffing that they desperately need, because I know that's a huge problem here, not only in Tennessee, but every other states facing this issue, especially in some, like, for example, I have one of my counties is a very rural county. It's a distressed county, and they have a very difficult job trying to get correctional officers in there. And I know that sometimes they're stressed out because they're having to be there for 2 or 3 shifts and take away from vacation time that they'd planned because they have to be there. So it's a big issue, and we need to try to help Department of Corrections here in Tennessee to address those issues. So thank you very much, each one of you, for being here.
Thank
you. Next, we have the Tennessee Corrections Institute. If you'll come forward. And I think you've been here before, and thank you for being here. Yeah, you can just have a seat and just identify yourself, and we'll proceed.
I'm a one-man show today.
Okay. Yeah.
I'm William Wall. I'm the executive director of the Tennessee Corrections Institute. I want to thank you, Mr. Chairman, and committee members, and Meredith for aligning this. And I am the jail guy who's sandwiched in between all the prison and reentry. So, and we are the agency that is the independent oversight body for all local jails across the state, and approximately 120. Basically, congratulations. I think the idea they're stealing from Tennessee to do on the federal level. So I think that's a great thing. I know we're here today to talk about overcrowding a little bit. I know I received some questions about, what percentage is overcrowded. Well, we do have about 38 facilities that are overcrowded across our state. Is detrimental, is problematic in those facilities, and it all falls on the locals. It all falls on the sheriffs or the mayors across the state if that jail is overcrowded, and the court system, of course. And mostly I came here for answering questions. So I have a bunch of data in front of me. If you have any questions related to your local jails, I'll be glad to expand on it, whether it's in your region or the state as a whole. Of course, we're the entity that's responsible for training all the local correctional officers, the unannounced inspections, which occur annually, then with 60 days if they have any deficiencies to fix that. And there's a plan of action option for the overcrowded individuals, and also a decertification process, which I'm proud to say out of the over 120 facilities, we only have 5 that are decertified. Right now, 2 of them are out of commission in Cott County that are uninhabitable at the moment. We're working with them to get all that worked out. But if you all have any questions related to overcrowding or anything specific, that's kind of the guidance I got coming here today, was to talk about that and the impact. So I'm here for your questions.
Thank you for being here. But yeah, I know the overcrowding has come to my attention recently, and called the Department of Corrections, and they have addressed my concerns and have done something about it in my area. So they're responding to that. I know Commissioner Strada, he's been working on that, and that's been an issue of having the state inmates in the local jails and overcrowding that it causes. So he's got a big challenge there.
Yes,
so far as having bed space and with the shortage of correctional officers in the prisons, and then also even the local jails. But it's a big problem. We just want to work together and what do we need to do to try to solve it? So.
One of the things that I'm noticing across the state is there's an inordinate amount of pretrial felons that have been there for extended periods of time. Yeah. And I don't know whether it's, something with the judicial system. If you talk to different sheriffs and mayors across the state, they have different opinions on the matter. But what we do see is the numbers of pretrial felons that are in local jails. There's a lot. And it's not normal in some areas where it's 25-30% of a jail population, and that's not normal. And some of them are sitting there for 2 and 3 years. It could be on the accord of the person who's about to go through trial, or it could be the court system is so backed up. Just from the still we're trying to weed through what happened during COVID with the citations in lieu of arrest to figure out who still needs to go to court or who still has a case pending. So there's a lot of people. There's over 27,000 people in our local jails, which is larger than our prison system. So it has gone up about 6% in the last year, but it's about 85% to its capacity statewide. We've been worse. Prior to COVID, we were at about 98% of our capacity. Now, there have been some jails that have been built. The problem is construction costs are between $800 and $1,000 a square foot for building a jail right now, and rural and distressed and at-risk communities can't afford to do it. Yet most of those that I'm speaking of are the ones who are overcrowded, and it's a challenge for them. And there is no money, federal money, any type of money to build a jail. And it can affect a lot of things. Like we talk about programming and reentry and work release. We're working on some things in our standards right now to really try to address those. However, if you don't even have a room to have a program in that addresses, mental health or substance and alcohol abuse, it becomes problematic, and your locals a lot of times can't afford it, not unless they raise their taxes, because that is a capital project for the local community, and it's just expensive. And we work with those facilities to try to keep them certified on a plan of action through what they're doing. And the one positive I'll say is I've heard a lot about staffing today. We have seen a positive trend in the locals with our increased training efforts and our peer support network that we're working with the public safety network on to help. We have seen a decrease in the turnover in the local jails. And so some of the points that they brought up are working, that we are seeing a difference. Because I will say Tennessee, when it comes to the local jails, most states are looking to us to see how we do it at TCI.
Okay. Senator Pody, you're recognized.
Thank you. So you said that the staffing is actually getting a little bit better for the locals. Can you walk me through?
I will say retention's getting better, and the best indicator for us is the amount of in-service versus the amount of basic training. There's still approximately about a 27% vacancy rate across the state and local jails. But what we see is when the amount of in-services that we're teaching tell me they've already been through a minimum of a year of basics. So if our in-services are going up and either we're steady or a little drop in the amount of people who are going through the basic training, that tells us that we're retaining more officers. Because of the amount of in-service that we're doing, we're keeping more people on board, because past that first year of basic, the in-services should go up depending on how many people are working in the local jails.
So I actually got to tour one of the local jails here in Davidson County with the sheriff, and he had expressed that they were doing something with part-time people, not paying them any kind of retirement or benefits or whatever, but $30-some per hour to do a few shifts, which seemed to help his staffing shortage. Is that elsewhere? Or is that just pretty much a trial program here?
No, sir. The local jails across the state are doing whatever they can they're mainly targeting the retired population, where they can hop. It's very similar to the 120-day employee model that the state government uses, where when someone retires or they just decide, hey, I don't want to work 40 hours a week anymore, they can come back part-time, but they're essentially fully trained and still have to meet the training requirements and things like that. It's pulling someone off the street a lot of times and placing them in that environment is not ideal, but where they're capturing them is okay, I know you want to leave and I know you want to do something else, but hey, would you still work part-time here because you're good at your job or you're retiring early?
Okay.
But we're seeing that across the state. Yes, sir.
Okay. Chairman Briggs?
Yes, just a very, very basic question. So the Tennessee Correction Institute, you go and look at, do you actually inspect jails?
Yes,
And,
sir.
is this sort of the role that someone like an IG or someone like that would have with the?
Yes, sir. That's where we were set up in 1974. There was a horrific jail accident in Murray County where it caught on fire and visitors, and it was the worst jail disaster until there was another one in Florida at some point in time. And the Tennessee Corrections Institute was actually set up as that entity to have oversight. We do unannounced inspections, just as some of the people were here before us. We work with the sheriffs through technical assistance, helping them bringing the stakeholders to the table and the training. So as some of them were, that's why I was like, it's like you're reading our statute.
Mm-hmm.
The way some of them were talking about how to set up that independent organization. But I do know a lot of states and others have been looking to us to, implement it related to their local jail system and police lockups.
Mm-hmm. Just for the sake of time,
Yeah,
that's the only
sure,
question.
of course.
I
Yeah,
had.
proceed.
No, I said that's
Oh,
all.
okay. All right. Thank you for any other questions, Senator Pody? Okay. Senator Pody?
Just one. So who do you report to? Who is it that sets you up? Is it the General Assembly?
We have a board of control, and our board of control is appointed by the governor.
Okay.
And the commissioner of the correction is one of those who's on our board. Plus, we have a mayor, a county commissioner, 2 sheriffs, and a person from the governor's office. There is appointee from the governor's office. So it is an independent board that's appointed by the governor.
Okay. Thank you.
Okay. Well, thank you. I appreciate it. It's always good to.
I'd
Go
like to
ahead, yeah.
provide one quick update,
Sure.
if that's okay with
Yes,
you
sir.
all. As I talked about, Cott County and both of their facilities. They have 2 small facilities in that county. They've had to evacuate them. The buildings are uninhabitable. I'm working with the governor's chief of staff right now to look at some long-term options to help them out. Right now, they're working with Jefferson County on utilizing an old building that they had shut down as their former workhouse to house some of them to help reduce those costs. Unicoi County, they are dealing with major sewer issues and potentially looking to have to evacuate one or both of their facilities. So, and then Greene County has had some major water issues. They have an 18-wheeler with water backed up to their jail currently right now. We're hoping that no further evacuations, but I also want to say Sevier County, Jefferson County, so many counties in that area have really stepped up, Knox County, to help. And we talk about state officials going out there. I mean, we help coordinate it, but it's the locals who are doing so much of the work in other counties and local county governments. I just need to send praise to them. And if you hear of anything coming out of Cott, Unicoi, Greene, or anything out of that region that was affected, please ask that you open your ears. And if there's anything we could send their way to help them, you don't talk about a disaster. Cott County is rural, but also a distressed county as well. Unicoi, I believe they were at risk, but they are struggling. And I just ask that if there's anything we can do to help, I would hope so. But thank you for your time and let me say that.
Thank you. Appreciate you coming here. It's always good to see you.
Good to see you.
Yes, sir. Okay, next we have the Tennessee Community Corrections Association. Get y'all to come up and take a seat. And just whoever wants to go first, you'll be identified, but identify yourself. Make sure your mic is on. The little red light on the mic will be on and you're ready to go.
Good morning. And we want to thank the committee for allowing us to come before you today just to hopefully maybe update you on our status. I'm not sure if you remember, we are currently at the end of this RFP, which was dramatically changed about 1.5 years, 2 years ago. And we are here before you today to pleasantly tell you that we have made some progress. We have worked really hard, not to say we don't have a few challenges still going into this next RFP. We're excited about the communication that we're having with TDOC and how we're going to improve even more so in this next RFP to meet these challenges that you've discussed this morning with all the other agencies across the state. And we hope to help meet those needs and challenges, and we feel that we can. So with that being said, I am Christy Holt. I am with the 19th Judicial District. I'm the director there of the Supervision Program and also the Day Reporting Center and Community Resource Center that we now offer to those communities in the courts. We do continue to offer the intensive supervision, which my judges want to send a big thank you to you too, because they truly rely on that. And also the offenders will also send me to you to say thank you, because it really, really helps them tremendously. The accountability that's built into what we do, they tell me over and over daily how that makes such a big difference for them. And we do lend ourselves still available, even aftercare services, just so you know, even with the supervision side of it, we also lend our hand continuously if they want to come back and just get additional help, advice, counseling, resources, and all those entities. So it doesn't even stop. I just want to let the committee know that we're still open to help in those instances. As part of the new grant that all of us have had to adjust to, with it being treatment oriented, we have all obtained licensure through the Tennessee Department of Mental Health. We have worked very closely with them on our facilities and got things that we need to do to kind of be in compliance with them as well. We've brought on clinical staff. We have LADACs. We have some have actual. I have LCSWs, as we all have to have, and some even have more. I know we coordinate with doctors out in outside resources to help guide our clinical staff, which just adds a whole nother layer to resources that we can get to our offenders. And I know in my office, and I'll let the others speak for their individual offices, but they meet with them weekly. We actually have them come in every week and speak with the offenders for any issues that they may be having. That includes mental health resources, that includes substance abuse resources, that includes housing, that includes honestly any issue the offender brings to the table in our office and day reporting centers. I'm sure they do it in the IOPs as well. We also have a residential program in Davidson County. There is not an issue that the offenders can't bring to the table through community corrections. And we've done that for years. And we want to continue doing that in the next RFP and actually grow the services. I heard mention that, maybe there needs to be more of an individualized approach. That's exactly what we're going to head into with TDOC's guidance, with more of an individualized program. So it's not so boxed off. We can actually meet with each individual offender, even more so than we already do, to kind of hone in on what needs to be targeted first. Not sure if you're aware that we do that already in a sense with a risk assessment. We have a risk assessment that we sit down with the offenders and actually, it takes about an hour and a half. We talk about anything and everything that they need to discuss from when they were small and what they had to deal with all the way to present day. We try to identify those services, those issues, maybe where they got hung up, and we go forward with that with our treatment plan. Again, we do the treatment and supervision. We also provide services not only for the courts, but TDOC probationers. They have referrals they send to us. So if they start struggling with maybe a lesser amount of probation supervision, they can send them to us through these treatment centers for additional support before doing violations. That option is there. And that, again, is to address one of those issues about maybe not sending everybody to prison. That's exactly why we're here.
Yeah.
We want to meet those needs, and that's basically our foundation. When we started 40 years ago, we were to help relieve that problem. And we've only grown since then, if given the opportunity to add services each and every year to each offender or individual. I know within my community, and I'm sure my cohorts will say the same, we have branched out into our communities. We've made partnerships. We've brought on board not only mental health help, we've brought on board any other issue. I know myself, I have churches, I have local government that has jumped on board to vest in our program. They like having us there. They know it works. And they've actually, provided me a transport van so that I can pick up my offenders and get them back and forth to the treatment centers. And that's been a big asset. So I just want the committee to know it's not only us telling you this morning, we can do it. We're ready to do it. Our staff has been additionally trained on all programs that we offer, but also our local communities are vesting in what we do. So I'll open it up if some of my colleagues want to talk more about their areas.
Just real quickly, what part of the state are you
I am
located?
Montgomery and Robertson County.
Okay,
Yes,
all
sir.
right. Is there,
Yes,
okay,
sir. My name
just
is-
identify yourself.
My name is Brooks Stillinger. I'm with the program manager for Mid-Cumberland Human Resource Agency Community Corrections. We operate 2-day reporting centers out of Sumner County and Dixon County. Those are both up and running. We're taking offenders in that aspect. We're getting ready to graduate 2 offenders out of our Sumner County location in our day reporting center. Some of the challenges that we've had with the day reporting center, under this new contract.
If you would just
Oh,
pull your
sorry.
mic a little closer. So
Is that
just-
better?
Yes, sir.
Okay, and some of the challenges that we've had in the day reporting center are referrals. We get referrals from the courts as well as from, like Ms. Holt said, from state probation. The referrals have been, we've been getting them, but the process is not, I think, not what we expected kind of going into the new contract. But we've worked with TDOC and they're aware of the referral problem, and they have done everything, in their power to try to, rectify that situation.
Just the referrals, they come from
We get
Department of
referrals
Corrections or from
the court. The court
courts?
can refer them to the day reporting center, as well as, like Ms. Holt said, we can get those referred from state probation offenders that are on that supervision.
Okay, thank you. Go ahead. I'm sorry.
And we also are still doing the supervision aspect in all of our other counties. We do Sumner, Dixon, also do Cannon, Cheatham, Hickman, Houston, Humphreys, Lewis, Perry, Rutherford, Stewart, and Williamson. So we're doing supervision in all of those counties. And like Ms. Holt said, we are thankful of the legislation last year to allow that supervision. Our courts, they count on that supervision. We've done it for years, and that's something that they rely on us for. And those judges, with the new standards that we have, they want to add additional standards, like go back to some of our old standards that we have. So we have a balance of the issue that we're having. We have to balance the new standards that are in our new contract versus what the courts want. And some of them want to put on additional restrictions, for each offender. So.
Okay.
Hi, I'm Colleen McAllister. I'm the Director of Correctional Alternatives in Memphis. I just want to go along with what my colleagues have said. We are having a better relationship with TDOC, which we really appreciate. At least for my agency, we're still seeing some challenges with getting the judges and the judicial system to know that we still can accept all the offenders. That's been a real challenge in Memphis. And I'm not quite sure how to fix that. We've been working on it for 2 years, but we keep working on it. And I'm going to let Tracy talk about the IOP program we do.
Thank you all, members of the committee. I am, as she said, I'm Tracy Matthews. I'm the Deputy Director with Correctional Alternatives. We've been facilitating the Community Corrections Program in Shelby County for about 32 years. So we've been around a very long time. One of the challenges, as Ms. McAllister was stating, in terms of our referral process in Memphis, as unlike some of the other counties in the state, we have 10 criminal courts that run every day, all day long, as opposed to some of the other jurisdictions that don't have nearly as many different individuals, personalities, and that. One of the issues is that in Shelby County, we had 2 other community corrections programs, both of which were residential facilities that are no longer providing community corrections services. And in the process of those 2 agencies no longer providing services, our judges got the impression that we are also no longer in business. So even today, we still kind of struggle with, they feel like because the other 2 agencies are no longer in business, that we are no longer in business. Even though they see us in court every day, they see us over there working and talking. There's still, it's just confusion. And I think part of our issue is because we have so many different people. And in this past year, we also gained 5 new criminal court judges who were totally unaware of what we do, how we do. They're brand new to the criminal courts in general. So we are working on that. We are always looking for ideas and assistance to help with that. One of our judges has been on the bench for a very long time. He is currently our administrative judge. He is one in particular that he thinks that we're not receiving funding, that we're no longer in business. So we have it's kind of a domino effect going throughout the judicial system there in our county. But we are plodding along. We are getting some referrals. We have some courts that are coming through. We are providing our own intensive outpatient treatment inside our office. We have licensed staff, just as
our other colleagues have mentioned, we're also providing similar services in our county. We service one county as opposed to having multiple. So we're in a more of an urban environment, and we provide all of these same services: mental health, treatment services. We also facilitate the intensive outpatient program, aftercare, all of those things. And as a treatment provider myself, I am a LADAC here in our county. I think we would like to ask for a little bit of flexibility within our treatment programming. Right now, we're mandated to provide 150 hours of treatment services, 9 hours per week. 9 hours per week is the average recommended dosage of intensive outpatient treatment that is mentioned through SAMHSA. However, there is not necessarily a cap, or there's not a bucket number saying you need 150 hours and that's that. We have some offenders that may need less than 150 hours. We have some that may need more than that. We may need some that need more intensive residential treatment. So that would be one of the asks that we might ask for some assistance on, is to maybe have a little bit of latitude and flexibility in the treatment services that we offer. But we do appreciate absolutely everything that the Department of Correction has done to help us out moving forward. All of our conversations, I think, have been positive, and in each of our jurisdictions and counties, I know our departments, the people that we work directly with through field services with TDOC, have been extremely helpful with any of our requests and anything that we've asked of them. And I would like to take the opportunity on behalf of all of us to thank you, Senator Jackson, for sending the letter on our behalf to the Administrative Office of the Courts. It was most helpful. We really do appreciate each and every one of you. Thank you for allowing us to come and speak today.
Yes, ma'am. Thank you. Okay, Senator Pody, you're recognized.
Thank you. And it's very encouraging that all of you have been saying that you're having improving relationships with the department. So I appreciate that. And I believe the commissioner has even assured me that he's reaching out to y'all to make sure that the next RFP would be a better one than it was in the past. So there was, and Christine, let me just start with you. There was like 19 organizations like yourself. How many are still in existence in Tennessee now?
We have 13 in existence right now.
13. And how many individuals do you all supervise amongst the 13? Do you know?
It varies between programs because of what happened, and we were forced to roll over what we had on supervision. Some of those that probably could have came to some of the treatment at that time did not get an opportunity to do so at the time. So depending on what counties we supervise, the numbers will vary.
Can you give me an overall what you think it is in the state rather than trying?
I can give you mine.
Tell me
I
yours.
have about 65 inactive and 65 active right now,
Okay.
with another additional 10 in actual treatment.
All right. And then the last question, how much does it cost? Are you compensated by each individual that you're supervising, or how's that contract work? How much does it cost?
We do not charge the offenders for their
Okay.
services, so it does not cost the offender anything.
Right. How much does it cost the state?
It still averages between, $5 a day, depending on what services
$5
they
a day.
receive. Because
Okay.
again, if we could individualize like we're wanting to, and that the number of services they receive could go dramatically up or be reduced to a slower, number, because they might not need a whole year's worth of treatment. They might only need 6 weeks of treatment. So the numbers
Okay.
could vary dramatically.
All right. So would yours be the same, about $5 a day?
Yes, sir.
All right.
All of ours will be about the same.
All right. And yours about $5 a day?
The cost per day, yes, about $5.
All right. Thank you.
The risk assessment that you talked about earlier, is this something that you do with each inmate to know how much treatment they might need? As you said, some need more, some need less, and I guess that's how you determine what type of treatment that they do need, how much.
Yes, sir. We actually do a risk needs assessment. Each offender will have that, typically regardless supervision and or treatment. Our treatment clientele will actually receive an additional assessment, an ASI, that we do in addition to that. That's more 30 days approach. One is more long-term, one is more individualized to 30 days back. So
Okay.
we actually have more than one assessment.
Does every inmate that goes through community corrections, are they required to have this risk needs assessment?
Yes, sir.
Okay. All right. Chairman Briggs, you recognize.
Yeah, I guess the question I have, and I think I've asked this every year, and I just got to get it straight in my mind again, because, what came up on some of these contracts with community corrections was, what is, when a judge sentences someone and the determination's made, he's going to talk to you or to the Department of Corrections with the daycare, I call them daycare centers, the day reporting centers, is how in an ideal situation where you have a full community corrections program and a full staffed day reporting centers program, or where other people can go, what decisions go into where the judge would send that person? What I'm really asking, what are the essential differences between what you provide and what the Department of Corrections would provide? If all things are equal in the community and everyone's fully staffed.
I'll speak on as far as my area. The biggest differences that I've had in conversations, not only with my local government, but also the offenders, is the availability that we can provide. I mean, I have offenders that come in daily. We're accessible. We're local. We can get them to the resources very easily. And I know with my courts, they appreciate that. Honestly, my judges don't even come with a lot of special conditions like some of the other areas do. They literally tell us that they know we will do whatever we need to help that offender with whatever need is brought to the table. And they like that. So they just looking at whether they want supervision and or treatment. In this particular RFP, if the judge is considering treatment because of a substance abuse issue, then he will have to abide by the guidelines that are in the current RFP to get them in our day reporting center. So there are some very strict guidelines right now in this current RFP that they have to go by to get them straight to the day reporting center. We're hoping in the new RFP that maybe those could be relaxed so that we could do a more individualized program with our judges to get more people into those services, is what we're going to ask. I know we have a meeting this afternoon with TDOC to discuss standards, and we look forward to that. So maybe we can actually open the door a little bit wider to get those. But right now, there's a rigid guideline for going straight to day reporting versus supervision. Again, I know in my area, if they give an individual for strict supervision and they start to struggle, they will ask me to consider moving them over into the treatment side. Don't give up on them. Just move them over into the treatment side if we can get them in those guidelines and continue to work with them.
Thank you. That's all.
So the purpose of the day of the community corrections is to have more individualized treatment for them to, and maybe perhaps keep them out of a correctional facility so we don't have fill the beds in each individual correctional facility. So that's the purpose, from what I understand, of community corrections. Is very effective. I know in my district in West Tennessee, I know every judge personally, and they have really been saying we really need this back in our area again. So because it's very effective. So thank y'all for what you do. We appreciate it very much. Anything else from anybody? Anything else y'all have to say?
Thank you for
Thank y'all for being here very much. We appreciate it, and glad y'all having conversation with the Department of Corrections. So thank you. Okay, I think next and last but not the least, for sure, is Commissioner Strata and the Department of Corrections. And if you'll come forward, Commissioner, thank you.
I might not, so I won't either.
Commissioner, good to see you. Thank you for being here. Appreciate it. And sorry you had to wait so long, but it's worth the wait. So, yes, sir. You can recognize to proceed however you want to do it. Just is fine with us. You just go ahead. Make sure your mic is on, sir.
Good morning, Chairman Jackson and members of the committee. I'm Frank Strata, Department of Corrections, and with me today I have Assistant Commissioner of Prison Operations, Linda Thomas, Assistant Commissioner of HR and Talent, Ms. Stanford, my Inspector General Kim Golden, Assistant Commissioner of Rehabilitative Services Gail Fenkel, and Probation Parole, I have Assistant Commissioner Hanson. So I want to thank you for letting us be here today and talk about the work done by more than 5,000 correctional professionals in our prison and communities across the state. Our mission is to operate safe and secure prisons and provide effective community supervision in support of successful reentry. We share the same goal of protecting Tennesseans as the General Assembly, and we are thankful to live and work in a state whose lawmakers work hard to safeguard our citizens. If I may, I would like to take this opportunity to thank you and members of the General Assembly for your support of our agency and our staff. We understand that our mission could not be achieved without funding from the General Assembly and the legislation, and you all craft with the interest of public safety. I would also like to take a moment to acknowledge our employees in East Tennessee who have gone above and beyond to serve while also dealing with the devastating effects of Hurricane Helene. Fortunately, our facility in Johnson County was spared, but several of our employees were personally impacted. Those employees still show up to work so they can keep our facility secure. It demonstrates their commitment to keeping Tennesseans safe, and we're grateful for their service to this great state. I'd like to point out a few important strides my leadership team has taken over the past 21 months. First, we have taken extraordinary steps to enhance staff safety and the safety of our inmates. We've invested nearly $8 million in safety equipment such as body armor, additional metal detectors, radios, mail scanning devices, etc. We have made significant gains in the prevention of detection of contraband inside of facilities, and as a result, contraband incidents have declined by 25%. That means we have fewer cell phones, drugs, weapons making their way into our prisons. We've developed a new centralized commissary operation that not only reduces contraband, but it improves efficiencies, but it also provides jobs for 70 inmates who are learning new job readiness skills by helping them run that operation. I want to thank Governor Lee and the legislators' continued investment in correctional education, as we have partnered with 11 different colleges and universities to provide both vocational and post-secondary opportunities to prepare inmates for success upon release. This past fiscal year alone, more than 1,400 inmates earned either their high-set diplomas, vocational certificates, college degrees, or skill-based certification, and hundreds of more are enrolled in these educational programs. Like correctional agencies across the country, we have focused heavily on our recruitment efforts to hire new staff by holding rapid hire events across the state and making conditional offers on the spot. We've held job fairs, visited colleges, military posts, as well as enhanced our advertising campaign to attract employees. Every opportunity we get, we encourage anyone who is considering a career in law enforcement to join our team. With that, Chairman Jackson and committee will answer any questions you have.
Thank you, Commissioner. So, Senator Pody, if you want to go ahead.
Okay. I've got several, and the first one I want to go through is vacancy. I think you've heard all morning, we've been talking about vacancy rates and turnover rates and such. Can you walk me through where we are with the department today?
Yes, I'll turn that over to Assistant Commissioner Stanford, who has that information.
Thank you. Good morning, Assistant Commissioner Heather Stanford, Human Resources and Staff Development. We are continuing to see a great trend in the vacancy and turnover rates. Both are continuing to decrease. And so currently today, our total headcount is up 177 over the number we were at this time last year, which is a really good positive gain. Our voluntary turnover, which is what we consider bad turnover when people are leaving because they choose to leave, has decreased from this time last year by 5.3%. And our transfers to other agencies have also decreased. We're down 20 from this time last year. So those are all things we focused on over the past 12 months.
Okay, so we're up 177. Is that specifically correctional officers 1 and 2, or is that across?
So that is total headcount on that one.
If we were to look at the correctional officers, those specific positions, where are we now with those?
So I can get specifically from this time last year, but we are sitting currently statewide at 27% vacancy rate.
All right, and which, can you clarify the class code or what is it?
So that's in correctional officers alone. Statewide is 27%. The highest vacancy rate by facility is at our Northwest facility.
Okay, and we did the pay raise. Can you walk me through what the results of that has been?
And so the pay raise in 2021, of course, made a huge decrease at that time. Then it somewhat plateaued for a couple of years. And now we're seeing that begin again to get better. I think the recent pay for performance increases were larger than in recent years. So we've actually had employees return to employment who had left the department years ago. And then we're also seeing, let's see, with the pay increases, I was trying to find. Yeah, so we're seeing much better vacancy numbers on that. The recent hiring events that we've held just in the last 12 months have resulted in 122 offers total for correctional officers. We actually just had 49 last week at our West 10 facility, which is our second highest vacancy rate.
All right, and we did a $5,000 bonus. I think that was over an 18-month period of time. Is that correct?
Correct, and that's still in place. So new hires still receive the $5,000 sign-on bonus. Also, our employees are still receiving a $1,000 referral bonus for any successful hires in that officer classification.
Okay. If we take that sign-on bonus, okay, and over an 18-month period of time, would it have been more effective just to give a flat raise of X amount, maybe not as much, or is that bonus helping?
I guess that would be on the actual employee, how they would want that money. I mean, some people like to have that lump sum, some like to have it as their salary. And the other thing we've actually included was a high security stipend for our staff that are working in our high security units. So they get an additional salary for that working in our high security areas.
Okay. All right. Now I've got, and this is saying a correctional security series salary compensation as of June 30th, 2023, and it's showing Tennessee at $44,520, comparing that to the states directly around us, and the average is $37,227. And I believe this is coming from y'all, okay?
Correct.
And such. Is it that we need more money? We're higher than a lot of the other ones. And Commissioner, I know you and I talked about Davidson County. And so I had my assistant call this morning, and they're not finding the $60-some thousand to start with. The only thing that we had found was, for seasonal people, they could get up to $30-some per hour, but I'm not finding the start out pay in Davis County at $60-some thousand. Where is that coming from?
Yeah, I think there's some information out there. That's their pay coming out of training, out of the academy. So I do believe the Davidson County or Nashville Police Department, Davidson County Sheriff is still starting higher than us, but we are a better pay rate than surrounding states at this point. I actually don't feel at this point the starting pay is an issue. We are hiring a large number of employees. We're trending to hire more than we have any other year, and we're showing to separate fewer. So I'm hoping that's going to show a better net impact than recent years. But as far as the hiring, we have really, really good turnout at the hiring events, and we're seeing successful hires out of those. So right now, getting people in the door isn't as big a problem as keeping them in the door.
All right. Is there one specific thing that you wish you had that the state could provide to help keep them in the door?
Longevity.
Longevity. Okay.
Yep.
All right. And we also had a program of augmentation. Can you walk me through? That was supposed to be a temporary program. I know, Commissioner, we talked about that briefly. Just walk me through where we are. What is this looking like?
Sure. So when the program started, of course, it was open to all TDOC employees to augment any facility that needed it. nearby. We've now cut that down. We're phasing it out. We hope to no longer need it once our staffing numbers are where they need to be to maintain safe facilities. But we have started phasing that out in certain ways. For instance, we've now limited the titles that can augment. So previously, a captain or lieutenant could even go and augment at another facility. We now only allow salary grades up to an M to do that. That's when the overtime laws change and they become managers. So we pulled managers out of being eligible to do that. And we also have removed facilities that are better than a 15% vacancy rate. So we currently sit at 3 facilities that do not use augmentation at all because their numbers are better than 15%. There's a couple others that kind of hover around that number. And then the others use those mostly at Northwest. So we're seeing a significant decrease in number of augmentee hours used.
Right. Is anybody forced to do that? Is it voluntary, or is there pressure that you need to step up and do this?
It's completely voluntary, and we've actually had a little more pushback on those that we no longer let do it anymore because we're trying to phase out the program. Our staff wanted to continue to do that and earn the extra compensation. So no, we've not needed to, nor have we ever mandated it.
And you heard earlier, I don't know if you heard earlier this morning, but testified saying that sometimes people will do that, but it cuts back on what they normally had to do. Is there any proof to that? Is there any?
No, our human resource office requires that what we call the first job be done first. So they are only allowed to augment if they're able to fulfill all their primary duties. For instance, our employees won't even augment if they're on a vacation day 1 week, right? So they do their first job first, and then they're able to volunteer.
Okay. And Chairman, I can keep going, or we can. So I want to do a comparison, if I can, a little bit. We got the state-run prisons, and we got 4 private-run prisons. Can you walk me through a vacancy rate and between the two? What is it looking like?
Now, I can speak to the 10 state facilities. I
Okay.
don't have access to private numbers, but I believe one of my peers does have
Okay.
that. Oh, no. From Core Civic.
We don't have the vacancy numbers from Core Civic. We have them just for the state.
Okay. So
I can get with them and get you the vacancy rates if that's what if the committee wants. We can get that sent over to you.
Right. So, Chairman, I believe that there'd be contractual things that they have to have meet certain rates.
Yeah, so in the contract, there is staffing, and they have staffing requirements. We have our contract monitors that are at those facilities that monitor the contract, and where they don't meet that contract for staffing, they'll get a fine. And Inspector Goulden can speak more to that as she oversees that area.
Okay.
Yeah,
So
we track the vacancies by position. Sorry, Kim
If you just
Golden.
identify yourself,
Sure,
just
Kim
for the
Golden,
record.
Inspector
Thank you.
General. We track the vacancies by position rather than rate. So there isn't a rate that's specified contractually. It's a list of staffing pattern that they're required to meet and staffing positions. So those are tracked positions, not by rates.
okay. I believe the request I'm making then is whatever specific information I can get about that the state would have access to of how many officers they have in each position, or I'm trying to find out and understand the difference between what we do as a state compared to private prisons. So any information that I could use as a comparison would be very helpful. And I think I've seen the lawsuit, in fact, this morning filed on from Trousdale, and that was actually mentioned was staffing rates and such in there. So any information that I would have would be helpful along that. So we don't know if there's per 1,000 or whatever. Can you at least tell me, are they meeting all their contractual agreements in the private prisons?
So there are vacancies in the private prisons, and so those vacancies often result in liquidated damages being charged to those private facilities for not meeting contractual obligations regarding staffing.
Okay.
As it's been mentioned here multiple times, staffing is an issue nationwide, and we have staffing issues in our facilities, and CoreCivic is not immune to that as well. So those staffing pattern, the vacancies rates that we see are very comparable to what you see nationwide.
Okay. And I'm understanding that. And what I'd be looking for then is you're saying that we assign them a fine if they don't meet that. Do you know how many times we've assigned that fine to them or that we've penalized them?
Sure. I mean, we assess them usually on a quarterly basis. So, I mean, we routinely assign a liquidated damage for staffing.
Okay. Could we get the last 18 months of what those assessments would be and how much they actually paid?
Certainly.
Okay. And this is actual money that we just withhold from their next payment or they pay us back? How does that work?
That's correct. So they would invoice us for their services for that month. If there's a liquidated damage assessed, then we would withhold that from their reimbursement.
Okay. So they definitely have the penalty and it's definitely assessed and we definitely get that money is what I'm hearing you testify to.
Yes, sir. And I
Okay.
have some of those numbers in front of me, but
If you would share that, that would be awesome.
of course.
Yep.
So currently, dating back to 2022, we have assessed a total of, this includes some pending amounts, $29,597,146.08.
Okay. And that's for all 4 facilities?
That's correct.
Okay. All right. All right. So, Mr. Chairman, I think that covers all the vacancy and turnover rates and staffing issues that I have. I can go to the next subject or I can turn it back over to
Chairman Briggs, do you have any questions or input?
I'm gonna ask some that's on our list here, and then we can come back if we don't cover those. I'm gonna have 2. One deals with the number of the state inmates that are held in the local jails, and how's it determined when someone is sentenced? Do they go to a local jail or do they go one of the state penitentiaries?
So currently our jail population, we've increased the intakes from the county jails by 10% over last year. Assistant Commissioner Thomas can go over how we move our county jail inmates, but those that are sentenced to the county jail obviously stay in the county jail. Those that are on the state sentence for longer than I think it's 2 years, they'll come to us. But with the 95 counties, what we do is we look, obviously Davidson County and Shelby County being our biggest counties, we take the bulk of them. But what we're doing is first in the county jail is first out. That's the method that we're trying to utilize. So we're trying to coordinate that movement from all the counties into our Bledsoe facility because that's where the diagnostic facility. But just over last year, our intakes are up from the year before. Now, do we get calls from the counties about taking image? Yes, we do, and we try to accommodate where we can. Our issue sometimes is because we have so many beds at the diagnostic center, we have to get them through diagnostics before we can send them out to the state facility. So sometimes it's a waiting period. And in some of our facilities, we have projects that are occurring like lock projects and building renovations that are kind of limiting our beds while those projects are done. We have that schedule when those beds come online so we can move quicker. But that's what we've been doing with the county jail. So we've had a great conversation with all of the counties about moving their inmates. And I have, if there's a specific county you want to know how much we've moved, the increase or decrease, if there's a specific county you'd like to know. But we are on it. We're aware of the population. And I think since I've been commissioner, we've reduced the population in the county jails by almost 50%. Some want to keep them though because of the funding.
I would like to add too, but talked to Ashley several times about this, mainly in Madison County, where they've had overpopulation. And so thank you for helping there. They really appreciate it. Sheriff Weiser is really appreciative of the.
Yeah, we've taken
reaction we got.
134, which is a 55% increase over the year before in
Yes,
that
sir.
county.
I just wanted to make that statement. Thank you. Senator Bodie.
So while we're on the jails, and I think I sent you, you should have gotten a copy of a letter I got from Davidson County. Okay. And there it was saying, is there an overcrowding issue? Yes. And that was number 4, where they were saying, however, I know that you and I believe are going to go meet with the sheriff because you've indicated you've been working very closely with them to alleviate this. So I appreciate that. But I'm just going with I've not gotten to talk to him. I'm just going with the data that I had received. So,
Sure. Well, in Davidson County, Senator, we've moved 300 in the past year. We moved 303 inmates, which is a 41% increase over the year before. And I've spoken to Sheriff Hall personally myself, and we've moved. Assistant Commissioner Thomas has been very involved in the movement of the inmates out of his jails. And we've been talking about the Metro Dade locations, and there's conversations ongoing with that. So I'd be more than happy to have that meeting and discuss any other issues or concerns that we could do in that area.
okay. Thank you.
You know, the next question that I don't know if it's going to be asked or we're going to talk about, but we did have it on the list. Could you give us an update on the death row procedures?
Where I can, yes. So we will have our protocols. We should have our protocols in place by the end of this calendar year or at the first week or 2 of January. We've been working with the Attorney General's office on writing those protocols and make sure that they're sound. And that's where we're at as of today. So we feel we'll have a product to produce by the end of this calendar year.
Has the holdup been procedures, or has it been obtaining, the drugs that we use? Now, all I really know about that's what I've read: injection and the electric chair. That's the only 2.
That's correct.
That's all.
Commissioner Bodie, you're recognized.
Thank you, Mr. Chairman. So the next thing I wanted to touch base on is, and you testified that the amount of contraband has gone down, which is great. Is there anything in our contracts that if we find a vendor that is consistently having their employees move in, that there's a clawback provision, or, if they're not doing correct, or is it totally on us to inspect? Does the vendor have any responsibility for making sure when they're sending food in or something that there's not contraband?
When you say sending food in, are we talking about the food service operation?
That's correct. Yes. So, I mean, there's just a lot of things that got to be shipped into the prison. I know you can't look in every single container and so forth. Is it totally on us to inspect, or does the vendor have any responsibility if there's things that are consistently being moved in by their employees that we can penalize them, or that we can do anything that way?
Well, their employees go through the same screening process as our employees, and we're the staff that are doing the checking of the items coming in. They're to maintain operations and have the integrity just as if they were a staff member working for us. I will say that any time, whether it's a contract employee or a state employee, if they're doing something that's contrary to policy or the law, we are doing the investigation and holding them accountable. If we're not aware of it, obviously, I always say if staff sees something, they have an obligation to report it. If staff see a vendor or a staff member doing something with an inmate, giving something with an inmate, obviously we want to deal with that. We've prided ourselves on taking the staff that put our safety in danger and the inmates' safety in danger and removing them from our ranks. That's not staff we want working with us. So I believe that the vendors have been working with us in that way as well. I know I've had many conversations with our vendors at the high level and talking about their staff and some of the concerns we have, and they've addressed it immediately. So if there's a specific case, I'd have to ask you to provide that, and we'll take a look at it. But they have to follow all the rules that we have to.
Okay. You mentioned that there was a big reduction in contraband. What would you attribute that to?
Staff. I would say a number of things. Our staff, I think we're more engaged with our training. Our staff are actually involved when we write policy now. We send it out to our staff. It doesn't matter whether you got 1 year, 15 years. They have a say in our policy. They're front lines. They're working with it. They have input. Our technology, the $7 million that we've invested in staff safety with the metal detectors, handheld metal detectors, tasers, Narcan, help our staff. We've done that and proactive searches. And I think a change in Assistant Commissioner Thomas's leadership in prison operations has made a tremendous reduction in our content. We're a traveling team. We travel our facilities. We go into the cells. We talk to the line staff. We ask them the equipment that they need. We don't want technology to replace the staff member, but wherever we can find technology to assist us, we're purchasing. We're upgrading our bus fleet. We're actually going to MCI so we can have a better movement of inmates across our states than Bluebirds. And this way we can put a number of different levels inside of our buses so we can move them effectively and safely throughout the state. So I think it's a combination, but most importantly, I'd have to say it's our staff, because our staff are doing the job that we're asking them to do. So I don't think it's one thing, but if I have to give the credit, I'm going to give the credit to our staff.
Okay, thank you. Now, there's a investigation going on, I believe a federal investigation going on with one of our private prisons. Is there anything that you could kind of enlighten us on what's happening on that?
The only thing I can tell you, Senator, is we have been working with them on any requests that they have, and we've been working with Core Civic through the legal departments. Whatever they're asking and requesting, we've been providing. That's all I can say on the matter. I have not spoken to anybody on that with the DOJ, but I know that they speak to my legal department as well as the Core Civic, and we've been working with them on any requests that they have.
Okay. Now, we had talked, I think last time you were here, about the Thomas system that's going to be coming online. I think we kind of
Thomas,
yes.
Well, that's been talked about a lot. So I'm happy to say that we feel we'll have the contract signed this month, and our new system will begin installation November 1st.
November 1st. Okay.
But that it will be a lengthy process. It will be about a 2-year process to change that from what we're currently having, our current offender management system, to the new one. So, but at least we're finally getting there.
Okay. We heard testimony this morning about the federal government having a new oversight board for federal prisons. And I know that we had somebody come in and testify today about that. We have local prisons with an independent investigation board. We don't have anything at the state level. I believe at one time we possibly did, but we don't. Can you tell me your thoughts on that? Why we wouldn't if all the other
I'm not for oversight boards. We already have a system in state that has oversight. We have comptroller audits, which work for the General Assembly. We have the American Correctional Association, which is independent folks that come in and look at our standards, which are state and federal standards that we meet. And we have our own internal audit system. I don't believe we need an oversight system to come in and tell us how we're doing. I've been doing this for 36 years. I think I know how to run the prisons, but having these independents, having the comptroller, ACA, and our internal audit procedures, I feel check and balance us and make sure we're doing the right thing. So I don't see a need for an oversight board. Now, we have the oversight board over our disciplinary process, and we've been working with that board tremendously. We're having great success with them, but no, I'm not in favor of oversight boards for corrections.
Okay. And I can appreciate with you having the experience you have, but we don't know who the next commissioner may or may not be. And that's a thought, not just for underneath you, but ongoing.
That's true, but the staff that are surrounding me and those at the other levels have that experience. It's not just the commissioner that makes the department run. It's the line staff, the first line supervisor, second line supervisor, the ladies and gentlemen that are here with me. I believe that the systems that this state already have in place with the comptroller, us ACA, again, and our own internal audit procedure, which we have changed and made more robust to identify safety and security issues inside of our prisons, and as well as inmate programming, I think we're doing the right thing.
Okay. Now, Commissioner, you and I, when we actually toured one of the prisons about a year ago, you had shared that iPads was coming into Can you give me an update on that?
Yeah, I'd love to give you an update on that. Actually, as of yesterday, our first go live for the tablets began at our female facility at DJRC. We have Attorney Center and help me out, Gail, Bledsoe and Mark Luttrell coming on in the next month or so. And within 6 to 8 months, all of our inmates inside of our state facilities and into our private facilities will have the tablets.
Okay. And how is that going to help you guys manage the inmates? Is that going to give us a better handle, or is it?
I think it's going to give us a tremendous, well, the benefit of the tablets is the educational opportunities and the programming opportunities are amazing. What's available on that tablet will also give the inmates, we're going to use the tablet as a phone. We're going to get rid of phone lines where inmates stand in the phone and try to control a phone line. We've standardized like commissary, where we're going to have that commissary list on the tablet. We're working with outside educational and other stakeholders to put apps on our tablets so they can get the information out to inmates. We're going to have banners on our tablets. So if I have to send something out to the inmate population, it's not going to get diluted by 2 or 3 other people. It's going to be the actual message. We're going to have also for staff safety, eventually the tablets, all our mail will go to a central location, get scanned and get sent back to the inmate on the PIN number. So our staff never have to touch mail and have to worry about fentanyl and any of those other things that cause danger to our staff in our mail rooms. So it's going to help us manage the inmate population better. It's also going to give the inmate population more opportunities for programming, educational opportunities, and staff a better opportunity to protect them with their safety by not having to come in contact with items they normally have to right now.
Okay. All right. Commissioner, next, I got another stuff. Okay. So the next subject I want to touch base on is when there's a death at a facility, what information am I allowed to get as a legislator about that death?
Well, I'll give, as a legislator, I'll give you what you need. We
Okay.
do now, understanding this, when there's a death at the institution, we are going to do an investigation. So I want to be careful that what you get is accurate and the investigation is complete. I can give you, the third story is always the truth, right? You hear that? So I'd like to make sure that what I'm providing you is accurate and that the investigation has been conducted. But I can always give you preliminaries, and knowing that you must understand that that can change as the investigation takes place and things change based on comments or situations or evidence, et cetera.
Okay. So what I'm trying to do is I'm trying to go with, and I know it's recorded so anybody can go back and see this, but TCA code 38-10-102, specifically looking at deaths in jail and who can have it, and the causes and determined by the state medical examiner. And then I went underneath TCA 68-3205 specifically, and it was coming back to who can get copies of death certificates and the except underneath D, and it comes into unless specifically by a state, local, or federal agencies doing research for what we're trying to do. And I felt that we were falling in this. And when I tried to ask for some of the information before, I think that I was getting very brief one statement or one word type answers because it didn't seem that it was legal to get that from me. So if there's a issue with that, I wanted to make sure I was able to clear that up.
Well, I have someone from my legal team here. You said a lot of acronyms and numbers. That
So I've got
area.
Okay.
Good morning, Chairman Pody. Elizabeth Foy, Deputy General Counsel with the Tennessee Department of Correction. You asked specifically related to investigations, and so the General Assembly is also subject to the Tennessee Public Records Act. And so there are certain restrictions related to confidentiality under investigative and safety protocols. And so each case is really evaluated on its own facts as to what documents are available and when those documents or information could become available. And we evaluate that on a specific case-by-case basis.
Okay, so what I would what I would be looking for is how many people are dying of drug overdoses. And in the last 2 years, it's going to say accidental death, self-injury, natural illness, homicide. I don't have any that have had drug overdoses, and I don't think that that's a correct statement. And I went back through. So what I am going to try and find this, and drugs is a definite issue within the prisons, and it would fall underneath our oversight. How would I find that information? Is that you're telling me that I've got to do a public record request as a state senator from this office, from this committee right now, in order to get that information?
Certainly not, Senator Pody. There are certainly elements of anything that can be provided to the committee. And if we're aware that you're doing it for a research basis, which is an exception to exactly what you've stated related to the autopsy reports, we're happy to provide whatever is publicly available at that time.
Okay, I believe I've made that request on several different times and have yet to get that. But I will put that back in writing to specifically say, I'm looking for drug deaths within the prisons of what is actually happening. But we can circle back to that. But there is not an issue legally, and that's what I've been told, is there is a legal issue that would keep me from getting this.
I'll have to look into that more specifically. I don't want to speak offhand because I'm not as familiar with the exact the exact specifics of the autopsy disclosures, because that statute changed over the last year. And before I speak to that, I would like to review it, but I'm happy to report back to you, Chairman.
Okay, thank you. All right, so the next one I have, Commissioner, is parole officers are not allowed to arrest anybody. Is that my understanding?
Good afternoon, Senator, or good morning. I think we're still in the morning.
Still in the morning.
I'm Chris Hansen, the Assistant Commissioner over Probation and Parole. So that is a true statement. What the commissioners asked me to do is we took a deep legal dive into what powers under the statute do probation and parole officers have. Their only authority is the authority that rests with the commissioner and what authority he chooses to give probation and parole officers. Commissioners choose to arm probation and parole officers. It's not statutorily, that's the commissioner giving them the authority. So the commissioners asked that we take a deep dive into this and to come back to him with recommendations of what we would like him to allow our probation and parole officers to do. And one of those areas is to make arrests. So I'm just started that. Legal has done the deep dive. I've started a committee of directors around the state to solicit their opinions on what we should allow our probationers, recommend what we should allow our probation officers to the commissioner, and what training those officers should then have to make that happen.
Okay, so we're waiting on your report to
Yes, sir.
So just for clarification though, does the commissioner have the authority, does this department have the authority to say they can do it now, or would it take legislative action to do that?
From my understanding, to the legal opinion we have received through our general counsel, the commissioner could grant that authority. I had the conversation with the commissioner about 2 weeks ago, and the commissioner asked me to come back with recommendations on what it would look like, what we should allow, not allow. So we're compiling that as we speak.
Okay. All right, thank you. And I only got 2 more sections, Chairman, or do you want me to go through or wait?
Let me ask
Okay.
a couple of things, because I know that they're important things that I've mentioned to you about some of the programming that you have. For example, the new, when I toured the Northwest with you and you went through the commissary packaging that they do, other things that you're doing with the community colleges and TCATs and things like that are programming that are very important in helping with recidivism rates of the people. They have skills when they get out or can have a job or whatever, get back with their families. So just to hear a little bit about that, because I think that's great. You're making great progress there and doing some great things along that line.
Yeah, we're very proud of that. And I'll actually turn it over to Assistant Commissioner Finkel. She has oversight of our programs and over the commissary operation. She was very instrumental in bringing that to us. So I'll let her speak to that.
Good morning, everyone. Assistant Commissioner Gail Fenkel. Thank you for the opportunity to speak with you today. I'll start with commissary. So the commissary operation was important for a lot of different reasons, some of which were safety and security and reducing contraband and things that would increase efficiency within operations. But what should not be overlooked is the opportunity to train inmates in a real transferable skill that they could gain employment upon release. Amazon moved here a few years ago and had 25,000 jobs opportunities. We are training these individuals through TriCore in pick, pack, and ship operation, forklift certification, and other Amazon-like fulfillment and packaging certification programs. That was an all-new kind of a vocational trade that we've brought into the prisons, and there's 2 locations, Northeast and Northwest, and approximately 70 inmates are benefiting from that. And since that operation will continue, we'll have some throughput on, as offenders release and more recruited into the program. Regarding education, so customer-focused government, our CFG goals. Thank you very much to everyone for the Correctional Education Investment Initiative, because it has allowed us to grow so many programs with all of, TCAT specifically. We have over 21 TCAT programs active. That's up about 45% from 18 months ago. We are, pedal to the metal trying to bring as much education in as possible. Our college programs have grown significantly. We have bachelor programs. We have associate degree programs with over 10 or 11 colleges and universities across the state. 411 individuals graduated from high school or the high school equivalency with their high-set diploma this year, which is 10% above our goal of 375 for the year. So hats off to our teachers and all of the staff out in the field that enable that education. But in addition to that, the pass rate was 75%. And the pass rate for high school across the country, the national average is 60%. So I think everybody's doing a great job. And while we struggle to get teachers, when we find them, they really, really work hard, and the more the merrier. We really need more help in that area because we're doing good work and they're doing good work, and we want that to continue.
You mentioned finding instructors. That was going to be my next question. And I know you struggle, the department struggles with that. What can be done on our end or whatever to help with that? I know it's like staffing. You have a huge issue there with.
Well, so we have a couple of great opportunities. First of all, I think it's word of mouth. I think within the teaching community and our principals, if we could leverage, those relationships and those positive experiences to help recruit more teachers. I don't know. We don't have a crystal ball. I don't think there's one answer. I can't say if you gave me X, I think we'd be successful, but I'll have to come back maybe with a list of ideas, if that would be okay with you guys.
Sure.
You all, gentlemen. I would also add, though, that Commissioner touched on the tablets. The tablets will not only have basic education, there's also going to be a premium education package that we'll launch after all the facilities and all the inmates have their tablet. Then we're going to launch a premium education package. In addition to that, we're working with TBR right now to find out if their learning management system can interface with our tablets. Then we can bring our existing programming to every offender in their hands. And a lot of these programs, like a new one with TCAT and electric vehicle technology out in Memphis, 80% of that is self-paced. Only 20% of it is hands-on. So that's another great program that we could take across the state.
Okay. Let's see. That's all I have right now. So, Senator Pody, if you got something, we're going on.
I will
close
finish
to 3
right up.
hours.
Okay. So
we need to probably wind it up fairly soon. So, thank you.
So 2 quick things before I forget this. So, Commissioner, you have always responded to me and have given me complete information whenever I've asked it. So our personal relationship is really cool. And I got to tell you, you've been bragged on by other people and said, Mark, this is really a good guy that's trying hard. These are people from the system. So I'm just sharing. I'm going to tell you something else. You've got Ashley, who has always been very helpful to me. Whenever I've called her, she might not have given the information, but I think she's given me the best that she can or that she's allowed to. So just I want to brag on her for a moment at the same time. So she's almost like a mailman. I can complain about the mail she's bringing, but I can't complain about her. Okay.
Yeah, Ashley is definitely a keeper. I just want to comment on the information. Is sometimes the information is it might be delayed because I want to look at everything that comes out of my office. Just because trust and verification, I want to make sure you're getting the right stuff and that I know where it came from. So sometimes the delay is really on me, not on my staff, because it's just important that if I'm giving something to the General Assembly or the governor's office or other stakeholders, that it's accurate based on our systems and the information that comes out of them.
Okay. So I only got two other things. One of them, you and I had talked about our DAs and the prosecution, and I didn't get to all of them, but I have asked to some of the DAs, and they said, Mark, there's no difference in the number of plea deals that we make with those that are coming from the prison than we do anything else. So you had mentioned that if we could get people to prosecute, it could help. So at least from the local ones that I've talked to, they are working as hard as they can that way. The last thing I want to touch on is the D boards. And I think you and I talked a little bit about this, and you said there was an appeal process that I was not aware of. How many of the people that have gone through the D board situation have actually appealed to your office or to the people in your office?
Linda Thomas, Assistant Commissioner. Senator, that is definitely data that I would need to get to you. I review, they do come into my office and they come in daily. So I don't have a count, but I can certainly get that information to you.
Okay, so I would like to get that information and how many are actually overturned or upheld or what, kind of walk that through. That would be helpful. And Commissioner, last thing I know you and I talked about, we've had different people come in and share things that they thought were going on within the prisons. And I owe it to them to just say publicly that you and I've talked about that. You're going to be looking into some of the things that have gone on to different prisons that I've specifically said. I don't want it to be a public statement, but I want to assure everybody that came in to testify before me and came in that we did take it serious. We did hear what they were saying, that you and I had a conversation and that you're looking into it. Chairman, that's all I have at this moment.
Okay. Chairman Briggs, you?
I'm good.
Okay. Just an update. I was on the phone with Congressman Kustoff's office in Washington just before I came down on cell phone jamming and the cell phones in the correctional facilities. He and I have been talking about this for probably close to 2 years now, and he's been working on this. Now, he's got several other congressmen on this that have signed on to his legislation. He's working with Senator Tom Cotton on the Senate side to do this. He was hoping that he could do something this session, but it's not going to happen. But hopefully next session, this legislation will happen where they can will allow jamming of cell phones in the correctional facility, just making them useless. And so I think you and I've talked about that numerous times, and I think that would be a big help across the country, that other legislators I've talked to, they have the same issues and problems, but there are two different versions. One increases the penalty for those that have a cell phone is one version, but the one that Congressman Kustoff wants to have, and he has others from Tennessee signed on this as well, as along with our state U.S. senators too, but would have the jamming allowed. So I think that would be the most effective. And I don't know your feedback on that or whatever you think on that, but I do want to respond to him. I told him we were coming down for this meeting today, and I wanted to mention that to you. There's some encouraging news that we might be able to address that hopefully in the near future.
Well, we would support the jamming over the higher penalties. Most inmates don't keep the cell phone on them.
Yeah.
Or it's a burner phone hard to try to trace it to the person. So jamming the cell phone would eventually turn it into a brick and useless inside of the facility. So that would be, I'm sure I speak for a lot of correctional folks, whether they're in state, federal, or local, that the jamming would be just a tremendous support mechanism for our facilities.
Thank you for that. I appreciate it. I'm going to relay that to him because there were two different versions, and his one I think that I like the most too. I wanted to get your opinion on it. So that's all I have. Commissioner, you have anything else in your
No,
department?
again, I want to thank you, Senator Jackson, Senator Pody, and Chairman Riggs, and other members of the committee that aren't here for just the continued support of our department and our staff and our men and women that are out there doing hard work every day. It's a tough environment, but they come through for us every day and for the state of Tennessee. So I appreciate that.
Well, I say this probably every committee meeting that we have. You have an extremely tough department. I've always said it's the toughest department. I think Department of Children's Services and Department of Corrections are the two toughest departments in state government that we have to issues that we need to address. So just appreciate what you and your team are doing. Enjoy visiting the correctional facilities. I think it's very beneficial. I want to encourage more legislators. I say this every time too. Please go and to these correctional facilities so you know what's going on, so you can make better judgments when we do have legislation involving corrections. So, but anyway, this committee, we're here to help. We want to communicate with you. Communications is a huge thing. So get the communications up and going better is great. And we've certainly had that, especially recently. So thank you for that. So if there's nothing else that anybody has, then we will stand adjourned. Thank you.
Chairman, you did a great job.
Oh,
I hope I followed through with.
Oh, yeah.
Good job.
Yeah, thanks.
I think that went
Meredith,
well.
thank you.
Yes, absolutely. I think that went well.
Yeah.
No, I think it was. I think, and the good thing is, we have questions. The questions